Okay.
All right.
Oh, let's see if I can find them.
Calling to order the special meeting of the Albany Unified School District Board of Education on Tuesday, October 6, 2020 at 6:02. May we have a roll call?
Superintendent Wells.
Here.
President Trutain.
Here.
Vice President Duran. I'm not seeing her in the attendees list just yet.
I think they both are waiting. Both Trustee Clark and Trustee Duran is waiting to be elevated.
Thank you, Dr. Wells. I just saw Trustee Clark. Okay, 1 moment. Okay, I'll continue with the roll call. Trustee Clark.
Here.
Thank you. Trustee Doss.
Here.
Trustee Hinckley.
Here.
Okay. Thank you, Ms. Shen. We'll continue with item number 2, the reading of the AUSD mission and vision statement and the meeting norms while you're working on the technical issues.
The mission,
Go ahead.
the mission of Albany Unified School District is to provide excellent public education that empowers all to achieve their fullest potential as productive citizens. AUSD is committed to creating comprehensive learning opportunities in a safe, supportive, and collaborative environment, addressing the individual needs of each student.
Our meeting norms are to maintain a focus on what is best for our students, to ensure a safe environment for all views to be expressed, treating each other, staff, and the public respectfully, to endeavor to find common solutions to issues through collaboration without sacrificing one's belief in what is best for the students, and to make a commitment to effective deliberation, each one listening with an open mind while others are allowed to express their points of view.
Thank you very much. I have a very brief introduction which has to do with a legal matter. The governor recently signed a new bill, AB 992, which is an update to the Ralph M. Brown Act. You may be familiar with the Brown Act. It's the Open Meetings Act. The idea is that it makes it, it establishes rules for how many members of a board or a legislative body can speak with each other about issues. The idea is that the discussion of an issue should always be at a public meeting and listed on an agenda so that the public can hear the discussion and participate. So this new update includes rules for social media. And as that is so common these days, it's important that all of our trustees know about this, and also that the public understands this. Because if any trustee puts up a social media post in any of the various social media channels, it is now illegal for even one trustee to acknowledge that post in any way. So on Facebook, you can't even like someone's post that, for example, says, you know, hooray, today is back to school day or something like that. So I just wanted to let all the trustees know that we are now legally barred from responding in any way to any social media post that has to do with a matter within the jurisdiction of the school board. And so we're barred from that. Now.
Can I ask for clarification?
Sure.
Are you saying that one board member can't like another board member's post?
Exactly.
Does that thank you. Does that include screenshotting that board member's post and sending that information to somebody else?
I don't know. You know, that's like a legal question. And since the governor just signed this on the 18th of September, we're still trying to get information on it. So the board may want to have counsel come to a closed session, since these are potentially litigious issues, to inform the board more fully about these new rules.
Okay, can we, I mean, the other board members can chime in, but I would think it might benefit us, especially since I think most of us are pretty, are on social media pretty often. If we could put together, you know, a workshop of some sort or a training to kind of go over this new legislation with the attorney.
I hear you. I think that's a good idea. It's always wise to be up on, you know, I mean, this affects us, right? It's a legal matter. So we'll look into getting that scheduled. And now we can proceed with approval of the agenda. May I have a motion to approve our very brief agenda for tonight?
I'll move that we approve the agenda.
I'll second. May we have a roll call?
Student Board Member Corzo Clark,
Yes.
Student Board Member Mala,
Yes.
and Trustee Doss,
Yes?
Trustee Clark,
Yes.
Vice President Duran. I don't see that she's on yet. President Trutain,
Yes.
Trustee Hinckley.
Yes.
Okay.
So the agenda passes 4 in favor and 1 absent to approve the agenda. And that brings us to item number 4, the student board members report. Please take it.
Leah, do you want to start?
Yeah. So if you weren't here at our last meeting, we had an update from Diversify Our Narrative, and then shortly afterwards, Dr. Wells sent out a letter to members of the community about a fundraising opportunity for Diversify Our Narrative to get these new books and materials in our classrooms. There are earmarked funds within our budget to buy these materials, but most of those have already been spent. And so this, by donating, you would help sort of expedite the process of getting these new diversified texts into our curriculums. And yeah, so please donate, and Audrey's going to tell you how.
Yeah, so we have the slide projected. There's 3 ways to donate, either through My School Bucks, logging into your account, or you can drop a check off at the Student Enrollment Center at 1200 Solano, or mail a check to the Bancroft site. And so far, or as of yesterday, we've had $2,200 in donations. So hopefully that will be increasing from here. Thank you.
Thank you very much. That's marvelous. I think that we're going to run this campaign for a while because this is very much needed. I see the Albany High Cougar on your slide, but I want everyone to know that these donations are for all of the schools. So this would be materials that would be used K through 12. So feel free to make a donation on behalf of all of the students in Albany so that we can diversify the curriculum even faster than we would be able to normally.
All donations are also tax deductible, in case you're excited about that. Sorry, you continue.
Yes, I am. I've already made my donation. I am excited about it. So We will move on to our main item, number 5, the staff report, reopening schools update, pivoting to a hybrid model of instruction. I want to remind the board that this is a staff report, so, and I'll let the public know too, the board has no item to vote on tonight. So we will not be voting, we will be receiving this report. So
I
Dr. Wells,
have a question, President Chutain.
yes, certainly.
Well, the first one would be is I'm not sure if we should start without Trustee Duran. And what if the board decides that we do want to bring something to a vote?
We can always give a direction to staff, but since this was not agendized as an action item, it would be handled as a direction to staff and not as a vote on the item itself.
Yeah,
So
I don't think when we made our decision in July to come back with October 6th, it was just going to be a staff report and we were going to be blocked out from having a vote if we wanted to.
President Tutain, can I add a bit of clarification? If
Sure.
it would be helpful. With the staff report, it does give you some options and you can treat it how the board so desire. For example, it could be a staff report that could be accepted, which is similar to review and action, or it can be a staff report that's accepted with some amendment, with some direction as President, and amendments that President Tutain mentioned. And so you have some flexibility here with the staff report because it's coming in the form of a proposal as we committed to the community and to the board back in July 14th.
It just seems as if whoever was on the agenda committee, you guys have basically blocked us off from having a vote. Doesn't mean that we need to have a vote, but to not have that option open is not okay, in my opinion.
Understood. I think that we have a lot of leeway here, but it is a report. It isn't a contract or something like that. So I'll hand it back over to Dr. Wells so that he can introduce this.
Okay, first and foremost, Trustee Clark, we heard you and thank you for your comments. Tonight, what you're going to hear in the form of a staff report is a school plan proposal for in-person learning. It would be a pivot. As you know, we have 4 tiers in the state of California that we use to make decisions about whether or not it's considered safe to do a number of different things in our arena to open schools, and when and based on what. And so back around March 13th, we moved to have our school closed and go remote. And then a governor order came out to do the very same thing. And since then, we've been collecting a lot of input from all of our stakeholders. We've been collecting input from our parents, our staff, our teachers, civic leaders, students, and even our board members. And it started back in spring with the Reopening Schools Task Force that was made up of those I just mentioned. And then we send out surveys to various groups to get more input. And we created and participated in what we call a thought exchange, where community members and staff can weigh in on issues related to reopening schools and how to do that. We held staff forums and parent forums and special ed forums. And even this Thursday, I plan on holding a superintendent forum at 6 p.m. More to come tomorrow, just to hear from parents their thoughts about reopening and when. Because we realize that this is a short meeting, less than 2 hours, and it won't afford enough time, I imagine, for everybody to weigh in on the report that we have this evening. But I wanted to let you know that I'm going to create another opportunity with the superintendent forum this Thursday at 6 p.m. Again, more to come tomorrow, and a reminder thereafter. But for now, I would turn this plan presentation over to both our Executive Director, Alexia Ritchie, and our Assistant Superintendent, Marie Williams, to present. And after that, we will have a Q&A and go from there. So at this time, I turn the report over to our Executive Director, Alexia Ritchie.
Thank you, Superintendent Wells and President Trutain and our board members and all of our community members who are joining us tonight. This is a remarkable period in Albany's short 2020 history, in that we are finally to the point where we can start to talk about plans to pivot to a hybrid model. So I'm very excited to present some information to you tonight. This information was gathered, and I certainly want to thank my colleague, Assistant Superintendent Marie Williams, as well as the rest of the district leadership team, our site principals, all of our staff members, and our community members who gave us input, as well as working with Alameda County Office of Education and the Public Health Department. These sources then were used to compile our reopening schools plan. So Ms. Sen, if you could start our slide presentation, thank you. Thank you. So we present this staff report tonight, October 6, 2020. As Superintendent Wells mentioned, this has been a long road to get to this point, pivoting to a hybrid model for Albany Unified School District. The next slide is going to show you some of the resources that we were using, in particular, the Alameda County Public Health Department update. As some of you might have read, as of October 13th, elementary schools, which includes transitional kindergarten through 6th grade, that complete the COVID-19 health and safety reopening plan are permitted to open. Again, that's the earliest date that any elementary schools in our county could possibly open. Elementary schools then are required to post their reopening plan to their school and their school district website, and we submit our plan to the Alameda County Office of Education for acknowledgement. Schools planning to open must notify the Alameda County Healthcare Services Agency of their decision, and of course, provide the website link to their plan. Many of you were also able to access the draft version of our plan along with the other Board of Education resources this evening. This is important. The decision and timing of when to open rests with each school and school district. And schools are not required to open if they are not ready. Again, is the intention of Albany Unified School District to have all of our plans ready so that we are opening when the school district has fulfilled all of the requirements as stated above. Alameda County will also consider permitting middle and high school students to return to in-person education in the next 4 to 12 week phase as local disease conditions allow. So just to summarize, opening in phases means that we start with our youngest learners, our preschool and our elementary schools, and then we pivot into the secondary schools, the middle school and the high school, being able to open within the next 4 to 12 weeks, depending on the phase of Alameda County's guidelines. Our next slide, please. These are some of the steps that Albany Unified School District still needs to take in order for us to be acknowledged to be ready for reopening. So per the Alameda County Office of Education guidance, these following steps may have to be taken in order to reopen. The first thing, we're working with our labor partners to determine staffing at school sites, including any necessary accommodations. Again, the goal of Albany Unified School District is to ensure that the safety of all of our staff members and students are a priority. That's why working with labor partners is also a priority. We need to procure a contract for surveillance testing of staff per state recommendation. Testing of staff is not a requirement. According to Alameda County Office of Education, it is a recommendation. So the Albany Unified School District is looking at our local health providers, at our resources within the county to see what we can do to provide testing or to have staff able to access testing per that state recommendation. The state recommendation is monthly testing once a month for staff. The school district is assigning an individual or a team to serve as the COVID liaisons, who will work with the public health on protocols regarding any potential positive COVID-19 cases. And tonight I'm formally introducing myself to the community as the COVID liaison. Also joining me is our school nurse, Monica Meng. So myself and Monica Meng are your COVID liaisons for the Albany Unified School District and the Alameda County Office of Education. In addition, we need to post our reopening documents that outline the plans. These include protocols on hygiene, face coverings, cleaning, disinfection, ventilation, physical distancing, health screenings, protocols for sick staff or students. In addition to the plan, there will be a school reopening checklist, which was just recently published, in fact, this afternoon. So combined with the plan, as your COVID liaison, I submit the plan along with the checklist to Alameda County Office of Education. After review, they acknowledge that we are ready to open. Next slide, please. Dr. Wells reviewed some of the timeline. I'll just go back and reiterate where we've been and where we are now. So in response to the COVID-19 global pandemic, Albany Unified School District schools have been closed since March 16th of 2020. And students continued their learning remotely until the school year ended on June 12th, 2020. Over the summer, all of our staff worked diligently on professional development that would prepare them for the 2021 school year remotely. And instruction began for all students on August 27th, with positive feedback received on the efforts of our teachers and an awareness of critical areas of engagement, technology, and instruction that need resolution. And again, as we're still in the middle of our remote instruction, we continue to look at our critical areas of need, especially when it comes to outreach and engagement with our students and our families. So tonight we present the plan for reopening schools under a hybrid model. Next slide, please. There are critical areas of the plan. I'm going to outline them now briefly, and we'll go to more in depth as the presentation continues. The first section is our commitment statement. Our superintendent has drafted a commitment statement, which again prioritizes the health and safety of our staff and our students and our community. The next section is quite extensive. It's going to be health and safety practices. I'm working with a number of people, including our Director of Maintenance and Operations, to take a look at what kind of face coverings we'll have available and what will be required. What will be our cleaning, disinfection, and ventilation procedures? How are we going to physically distance the students in each of the classrooms, in the common areas, and in outside areas? What kind of health screenings we're looking at? Some models have on-site health screenings, and some models have self-reporting screenings. We'll take a look at what's more appropriate for each grade level and each site. And protocols for sick staff or students. This might not be COVID sickness, it could be general sickness. What would we do and what are the protocols for serving and supporting those staff or students? The next section is around facilities, goes more into depth about the physical facilities and how those are being addressed during the COVID pandemic. And especially as we pivot to the hybrid model, what steps in our facilities do we need to take in order to ensure, again, the safety of our staff and students at all times. We get into section 4, which is the instructional program. Our Assistant Superintendent Marie Williams will be able to elaborate on the instructional program options, again, as we pivot from a remote model to a hybrid model. The next section, social and emotional well-being. This could include attendance, engagement, mental health, as well as food security and other issues that surround a student's social and emotional well-being. We take a look at some of our most vulnerable learners. I'll take the lead on special education and 504 plans. And Assistant Superintendent Williams is taking a look at our English language learners, as well as our students who require intervention services. The next section is about childcare and outlining our program to provide childcare, again, during a hybrid model. We also look at technology. I mentioned the food service. We also address transportation. And then finally, we have a section that includes frequently asked questions, as well as resources and important contacts. Right now then, that is the working table of contents for our reopening plan that I'll be submitting to the Alameda County Office of Education, along with the school reopening checklist. And now we'll go a little bit more in depth into the plan. The first thing we'd like to do is read the superintendent's commitment statement. We are committed to putting our kids, our staff, and our community's health and safety first. This is a top priority. We are committed to educating our kids in a safe, healthy, and caring environment. And to that end, when it comes to educating our kids, we prefer to educate them in an in-person model when it is safe to do so. And until then, we will continue with remote learning and offer a plan for in-person learning ready to go when we are called upon to do so. This plan is a reference guide outlining how we will return and what safety protocols are in place to ensure best as possible that our kids and staff remain safe while participating in an in-person instruction model. And again, we'll reiterate that the safety of our students, our staff, and our community is our priority. Next slide, please. I'll touch briefly on facilities. Our Director of Maintenance and Operation will also be available at the end of this presentation to address any specific questions. Again, from his department, the safety and students of employees is the first priority. Here are some of the items that he's already been working on in preparation for students and staff to return to campus under a hybrid model. At the site level, there are hand washing or hand sanitizing stations located in the common areas of all campuses. The stations then have been increased from what they were before, and there are additional stations at all of our campuses. Hand sanitizing dispensers will be located in each classroom, and the custodial team will be using disinfectant sprays located in each classroom as they go to sanitize the classrooms in between student cohorts. The campus sanitization. There are electric static sprayers which will be provided at each site for the daily scheduled sanitizing of the high touch areas. And indoor air quality, which is always a concern and a condition for students to come back and for staff to come back. The district's HVAC filters have been upgraded to the recommended MERV 13 filters, and they're to be changed at recommended intervals. And again, our director will be able to answer some of your questions at the end of our presentation. Next slide, please. I'm looking at health and safety precautions again as a priority. And Julie, if you could scroll up just a little bit there. The goal and the commitment of AUSD is to provide guidance which is necessary for limited in-person instruction, targeted support services, and the facilitation of distance learning in small group environments for a specified subset or cohort of students. So to summarize this first point, again, Albany Unified School District is moving forward to make sure that we have the structures in place to support students as they return in small cohort groups. At the same time, remember, we also need to balance what's happening with our remote learning at the same time. All staff, students, and families must understand the required health and safety practices needed to prevent the spread of COVID-19 in these settings. The health of the entire Albany Unified School District community depends on all of us doing our parts. So we need your help as we employ rigorous health and hygiene practices to ensure that returning to school is safe for everyone. Again, just reiterating our commitments and our guiding practices as we pivot to a hybrid model. Thank you. Next slide, please. Here are some basics when we're thinking about the health and safety precautions, again, as we pivot to a hybrid model. We ask that all of our community, our staff, our students, and our families know the signs and symptoms of when to stay home. Understanding how temperature checks work and any signs of illness that should be reported to your personal physician. How to use personal protective equipment properly and how to have that accessible at each of our sites. We briefly mentioned the washing and the sanitizing of hands, not just the equipment, but the protocols and best practices. Teaching the youngest students, for example, how to wash your hands for 20 seconds. The screening and distancing. Again, screening for temperature and wellness could be done on site or it could be a self-reporting system. And then the distancing in the classrooms and in the common areas, in the hallways, for example, and outside learning areas, making sure we have that 6 feet of distance when appropriate. The last bullet point speaks to what we do if there is a confirmed COVID-19 case, what those protocols are. Again, as your COVID-19 Albany Unified School District liaison, I'm going to be playing a pivotal and a leadership role if and when there is a confirmed COVID-19 case. The first thing we do is we prepare for that instance. For example, we're preparing a template notification letter that can be easily tailored to different incidents. And we're going to have this template letter translated into languages based on the identified needs of our school district. In this message, we want to avoid any messages that stigmatize a site or a group of people. And then we have worked intentionally on our concentric circles of information and communication, which will inform our community when and if we have a positive COVID-19 case reported to us. When there is a confirmation, again, as your COVID-19 AUSD liaison, I need to obtain documentation that a case has occurred. This would come from a family member, or it could come from a staff member or a community member. But again, there has to be confirmation, and that would include a medical professional also stating that this is a positive COVID-19 case. Then we go into communication. Our schools will immediately notify the COVID-19 liaison, myself, and Monica Ming, the district nurse. And then we start our concentric circles of communication. That's going to include the district senior leadership team, the board members, union leadership, the staff of the impacted site, the families of the impacted site. There will be a district to the entire community, there will be a district letter out to the entire community. And then finally, we need to include that information on all of our social media accounts. Because there will be, again, in this scenario, a positive COVID-19 case, as your liaison, I notify the Alameda County Public Health Department. The Public Health Department then works with me to determine the quarantine period, and if applicable, pivoting back to a distance learning platform. Thank you. Next slide, please. Assistant Superintendent Marie Williams will now describe program choice, and the hybrid model description.
Thank you. Good evening, board members, community. If you will recall, back in July, when Superintendent Wells presented a reopening schools plan, what we presented at that time was a hybrid model of instruction for all students. Tonight, I'm going to be talking just about that hybrid model as it pertains to elementary schools. As you saw on the first slide, as Executive Director Ritchie stated, we still might be a little ways off from planning a hybrid model for secondary, and we have begun to engage in some pretty concrete conversations, but for the purposes of tonight's discussion, we're going to be focusing on elementary. So what you see here is that we're going to be providing two options for teaching and learning for students. Option one would be the model that was presented to the board and which was approved in July, which would consist of two cohort groups of students, an A group and a B group. So essentially a teacher's class would be split in half. Cohort A would attend on Monday and Tuesday, and then cohort B would attend on Thursday and Friday. Just to sort of refresh our memories around this particular schedule, we identified a 2-day cohort model to allow for a Wednesday, middle of the week deep cleaning between cohorts in order to mitigate the spread of COVID-19. So if you will recall, one of the potential options that was presented by CDE was an AM-PM model. So that would be some students coming in the morning and some coming in the afternoon. But we decided that in order to mitigate the risk, particularly for our staff who are seeing all students in the classroom, that we would move to this 2-day rotation. So when the first cohort is in class on Monday and Tuesday, cohort B would be participating in remote learning. Synchronous and asynchronous is what we are thinking that would look like on Monday, Tuesday. All students would be able to participate in remote learning with their teacher on Wednesday, as they sort of do now. And then the cohorts would switch, and then the second group of about half the class of students would then participate in in-person learning on Thursday and Friday. One of the things that we have discovered that sort of is leading us to thinking about how to provide options for students who maybe because of medical reasons or other concerns would not be prepared to return for this partial in-person option is 100% remote instruction option. What we have learned, I think, through the planning that our teachers undertook and the professional development in which they engaged, is that in-person teaching is very different from remote teaching. And so, you know, I think we will all agree, could all agree that our teachers have done a really fabulous job sort of translating their in-person instruction to a remote format. So because we recognize that teachers cannot both teach in person and remotely at the same time, we are proposing that we would offer a 100% remote option, which would essentially include students participating in an online platform that would be supported by AUSD staff. There would be no direct instruction from staff because the content would come from the online platform, but there would be opportunities for progress monitoring support from AUSD staff. And again, this is because I think we recognize that teaching in person and also teaching online would be quite a gargantuan task to ask our teachers to take on at the same time in the same setting. So those essentially are the two options that we would be proposing. And as Executive Director Ritchie sort of alluded to a slide ago, in the event that there was a need to return to 100% remote instruction, because let's say of an increase in COVID cases or something like that, then all students would go back to 100% remote instruction until such time as it was safe to return to in-person instruction.
Thank you. Next slide, please. So combined with the academic supports and the academic structures that our assistant superintendent just outlined, looking at the social and emotional well-being of our students started a long time ago. In fact, on March 16th, that was one of the priorities of our professional development and our messaging out, was to make sure that we're taking care of our students in our community in terms of their social and emotional well-being. So not much will pivot, but I'll go ahead and summarize some of the important priorities for us. As you know, our community has experienced high levels of stress from the disruption of daily lives and worries about the physical health of oneself and others. And many have been under financial strains. So each student will need additional support and systems that will help to rebalance and refocus them on the task of learning and being productive in a hybrid school community. So Albany is committed to supporting the academic, the physical, and mental health and wellness of our students and staff, and again, make this a priority in our planning. Some of the social and emotional well-being best practices can be found in universal supports for all students. If, for example, a student needed a tier 1 support, they might find that from their classroom teacher. If a student needed a tier 2 support for social and emotional well-being, there might be a referral to an intervention team, a school counselor, or perhaps a mental health professional. And finally, if a student did need perhaps a tier 3 level of support, then we'd be looking at specialized instruction in special education if appropriate, a 504 plan, or other community resources. In general, we've been working with our classroom teachers, with our paraeducators, and with all staff members on classroom and school strategies to foster social and emotional well-being. And finally, I've taken the lead on attendance and re-engagement efforts. For example, our attendance codes not only reflect attendance, but also levels of engagement for our students. And we recently instituted some outreach efforts that included home delivery services, as well as wellness checks and home visits. Next slide, please. Thank you. In our plan, we specifically would like to make sure that we have prioritized the needs for our students with unique needs. I'll briefly discuss special education and 504 plans. When bringing students back to school within a hybrid model, especially those students with special education and 504 plans, we'll need to consider how those students would be able to adapt to the restrictions, such as wearing a mask. And additionally, many of these students require one-to-one assistance with close physical contact by staff. Again, the health, safety, and academic access for these students is critical to address on an individual level with students and families. IEP and 504 student communication. Every family who has an IEP or 504 accommodation has what's called an assigned case manager, whose role is to facilitate communication between the district and the family to ensure that the student's needs are met. Students with IEPs have case managers within the special education department, and students who have 504 plans have case managers. At the elementary level, it is your site principal. And at the middle and the high school level, it is your school counselor. We spoke more in depth about our continuity learning plans at our parent education webinar about a month ago. And our students who are receiving special education services, our case managers are working on writing those plans and sharing those with our families, documenting and planning how the school site closure and the hybrid models then will support their specific students. Interestingly to note, the continuity learning plan is very specific. One plan is drafted for 100% school closure. And as we pivot to a hybrid model, you will see that a new continuity learning plan will need to be drafted to address the hybrid model. Next slide, please.
Thank you. So I actually want to use this slide to sort of go back a little bit and talk about the instructional model. So this slide is speaking to supports for students with unique needs, and in particular, students who receive English learner services and also intervention services. And so currently, the model for these services to be provided is there is some time that is allocated at the beginning of the day and at the end of the day where students can receive those services in a small group and or individually. And so in our learning continuity and attendance plan, we sort of talked about some of these details surrounding how we would provide supports for English learners and intervention services. But one of the learnings sort of from this model that I think is also influencing how we might put together a pretty rigorous and engaging hybrid model for students who are receiving in-person instruction. And so now I'm sort of talking about all students again, is that we recognize that there are many staff that fulfill roles at the elementary. We refer to them as specialists. And so we have English learner specialists. We also have reading specialists. We have PE specialists. We have music specialists, science specialists for 4th and 5th grade. We also have some art also happening at the elementary. And so one of the things that we've been thinking about relative to sort of leveraging our specialists to support in our hybrid model effort is to engage those folks in providing synchronous and asynchronous instruction when students are in the remote cycle of their week. So in the 2 days, for example, that a student would be in class, they would be primarily and almost exclusively with their classroom teacher. But on the other days, there would be opportunities for them to receive PE and or art and or music. And those specialist services could be delivered, might be delivered on the synchronous and asynchronous day. So I was remiss in not mentioning that a few slides ago, but the opportunity has presented itself again here because English learner specialists and reading specialists certainly would be a part of that effort to support students either remotely, synchronously, asynchronously, or, we've been sort of thinking about ways to leverage also those specialists to sort of build the social emotional piece that we've talked about students needing so much. So would it be possible for there to be some PE happening sort of out on a field in an open space, giving students an opportunity to be together. So I think that we are really fortunate in our district that we do have a great many staff that we can sort of maximize their roles to ensure that students are engaged throughout the week. This slide is asking specifically about English learner and intervention services, and those services as outlined in the learning continuity and attendance plan would continue to be provided in a hybrid model. And we would have the flexibility to provide those services both in person and or potentially remotely.
Thank you. As some of you might know, I'm also taking the lead for our school-age childcare program. So early learning and care programs are critical to our community. And the Albany USD programs, which are located at the Albany Children's Center location and at each elementary site, are moving forward with a hybrid model. And as we move to a hybrid model, we'll work with families in our community who need access to the adequate care for their children while they're at work. In adherence with local and state health directives, we need to ensure compliance with all program requirements. California licensing has specific requirements then for the health and safety considerations of our preschool and our school-age childcare programs. And I'm working with our staff members from both sides of the house to make sure that our health and safety considerations are in place as we pivot to students in preschool and students in our childcare programs returning for the hybrid model. These would include then the staff to student ratios, which we're paying close attention to as we move forward with our enrollment. Thank you. Next slide, please.
So the next slide is having to do with technology. And so we will, of course, continue to provide access to devices and internet hotspots as they are needed by students. We have given out some 1,500 Chromebooks and iPads. We are on, we're up to about 200 hotspots. So as the needs continue to come to us, we continue to meet those needs. There was a question for one of the board members that stated, can we now say all students who need a device and hotspot have one? And I think I would hesitate to say that we can say that, but I would say that as we hear from families that they're in need of support and/or devices, we stand ready to provide those devices to them in pretty short order.
And I'd like to say that our Assistant Superintendent Marie can speak with this with great authority because she also serves as our Chief Technology Officer who monitors this area daily.
Sorry to interrupt. I have a quick question. Can we confirm the end time for the meeting?
It's scheduled for 8 p.m.
Okay, so we're already getting close to 7. I thought the meeting was over at 9 because it doesn't look like there's going to be a lot of room for discussion.
We're almost done with the presentation. I think we have about another 7 minutes.
Okay, thank you.
Thank you. Next slide, please.
I'll just briefly say, relative to this slide, we continue to applaud our Chief Executive Chef, Sabina, and her staff for providing breakfast and lunch grab and go services to our students. We would continue to provide those much needed and appreciated meal services during our hybrid instruction model.
Thank you.
For both students participating in hybrid and also students participating in remote instruction. I wanted to clarify that.
Thank you. And that's an ongoing service. Thank you. The next slide speaks to transportation. Our district is required, we are able, and we are committed to providing socially distanced transportation to our students with disabilities whose current IEP includes those transportation services. So with the social distancing measures in place, all available vehicles, their drivers, and the van riders will be utilized to transport students who require transportation. And this isn't just for Albany Unified School District school sites. It also would include students who are participating in non-public schools. Social distancing and safety measures include the use of masks for all passengers, plexi barriers between the drivers and the passengers, ensuring that 6 foot of distancing at bus stops while loading and unloading is adhered to, and again, strict cleaning protocols before and after all usage. So our vehicles need to meet all maintenance and inspection requirements before being placed back into service. And I want to thank our lead drivers, as well as our Director of Maintenance and Operation, Ben Borrego, for overseeing this activity. Thank you. Next slide, please. And I'll return this to Dr. Wells.
Thank you. This is where we have established our target dates for pivoting to hybrid instruction. As you can see, we have 6 bullets here, November 5th. These are target dates. Preschool age hubs 1 to 7 per classroom. Our target date is November 5th. And then we go into another phase, December 3rd, preschool age up and running as we know it before, best we can. And we would adhere to, at this time, the current health guidelines is 1 to 14. That may change to 1 to 16 in the immediate future. But as it stands today, the ratio for teacher to student is 1 to 14 based on our current health guidelines. January 7th, TK to first grade. We want back on campus in person. And then January 14th, second grade to third grade back on campus as target dates. And then finally for elementary, rounding out January 27th for 4th through 5th grade. And then for our secondary, both middle school and high school, our target date is March 15th. Now keep in mind, these are target dates, all subject to continual work with our labor unions and contingent upon our health guidelines. Keep in mind that the health guidelines can change. And so we remain flexible and ready to go when it's safe to do so, based on our county health guidelines, making sure safety is a priority and that we use as a matrix our county health guidelines. And I want to highlight that. Coupled with those stipulations that were spelled out at the beginning of the slide, other factors we have to consider in terms of our readiness to ensure that safety protocols are in place to mitigate any spreading of COVID-19. And that concludes our presentation and proposals for pivoting and going hybrid in-person learning. At this time, next slide, I believe it's Q&A. But before we get into the Q&A, I wanted to solicit, maybe we may need help, frequently asked questions. We had a lot of frequently asked questions, but I think the most profound question that we were getting from various corners of our community was this, because of a recent law and legislation that was passed by Governor Gavin Newsom. The question is, can staff opt out of providing in-person instruction? In other words, what happens if the board votes to reopen? And that's a really good question. And I think people avoid the question, but I think it's important to inform folks about how it happens. I believe it was Sacramento months ago who said, hey, the board voted to open school. And thinking that they had all the authority to do this. And then they realized they can vote to open schools, but if you don't have teachers ready to come back, there's no school. Fast forward just recently, about a week and a half ago, superintendent board over in LAUSD had plans to open the schools. And they too realized rather late, and they had to walk it back or run it back about a week ago, that they were not gonna open school just because the county health official says you can, don't mean you will. Because there's many, many factors to take into consideration for opening schools. And they too, like Sacramento, realized that if there's no staff, there is no school. And so it's important to work with staff and labor unions together in opening schools. And that's our commitment, to work with our staff and our labor unions to open schools together so that our kids can have the best experience in the safest kind of environment that we can provide for them. Having said all that, the answer to the question, can staff opt out of providing in-person instruction? The answer is listed before you. Teachers and staff have the option to take advantage of the Family First Coronavirus Response Act leave. This leave allows up to 12 weeks, 60 days. And 60 days is equivalent to 3 months, meaning each month is 20 work days for our staff of paid leave through December 31st, 2020. The Secretary of Labor recently clarified that employers may not require documentation prior to allowing employees to take the FFCRA leave. Rather, employers must provide the leave first, and employees are to submit documentation as soon as practical. Now, believe it or not, in legal arenas, they're still fighting over and trying to define as soon as practical. And what's legitimate and not legitimate. But what's crystal clear is that staff has that authority. So it behooves us to do what's best anyway, is to work with our labor union, moving together forward. And so that's what we're committed to doing here in Albany Unified School District. With that, we will open it up for a Q&A.
I have a question related to the statement that was just read. Since we're already on it, I figured it would make the most sense to ask the question directly related to it. So I guess my question is there a specification within that of what the documentation needs to be? And even if and then on top of that, is there clarification as to what would happen if the documentation is not provided once a staff member or teacher was to return to work? I hope that I'm asking that question in the right way. So basically, nobody has to submit the paperwork when they take the leave, but once they return to work after the 60 days, if they don't provide what would happen, or how does that work? Thank you.
That's a good question and a pretty detailed question. I don't know if Dr. Wells wants to address that, or our
Yes,
human
have
resource
HR
specialist. Yeah.
President Tutain, we have human resources ready to address that.
Can you hear me now? Yeah, okay, perfect. So let's see, so this leave is actually an expansion of the FMLA leave. And under that leave type, typically what you would require of an employee if they were requesting to take that type of leave is documentation from their healthcare provider. So if it were for an illness, you'd ask for a medical certification, and the same would apply if it was if they were taking care of a family member. And so when this was first implemented, it was passed very quickly at the end of March and available to employees immediately. And the spirit of this law was that it was for that reason, is that with all the changes and the closures of schools and businesses and the hardships that folks were experiencing, this was meant to try to provide a paid option for folks to be able to take leave of absence from their employment. And it provides protection. It provides protection so that you cannot take adverse action against an employee for taking excessive leave, that sort of thing. And so what happened is folks were, well, let me back up a little bit. So this expanded leave provided for coverage for folks who were either needing to quarantine or needing to seek out medical treatment for COVID or possible COVID. But it also provided protection and leave for folks who needed to take time off work because their child's school or daycare closed. So really expanded the options for folks to be able to take advantage of a paid leave of absence. And so given sort of the times and the difficulty and the challenges in being able to either see doctors or get tests, there were long lag times for that sort of thing. Folks were finding it difficult to be able to obtain the documentation necessary. And historically, under this FMLA umbrella, we would, as an employer, we would require the documentation prior to allowing employees to be able to take advantage of the leave. And so there was a lawsuit that was brought by, I believe, the state of New York, asking for clarification around some pieces of this law. And one of the clarifications that came down from the Department of Labor was that the documentation piece, that the spirit of this leave was to provide emergency leave for folks, either for sick leave for themselves or for the childcare reason that I mentioned before. And so the clarification just came down on September 16th that says that just what you see here, that you are to provide the leave first, and then the documentation can come as soon as practicable, because sometimes that documentation might come from a doctor's office and you will get it eventually. But other times it could be that the person has in-home childcare, maybe a family member who's taking care of their children and who just doesn't feel comfortable anymore or safe being able to provide that childcare service. And so you might not ever be able to obtain, formal documentation that as we once knew it. It might be something as simple as an email or a handwritten letter that says, I don't feel comfortable doing this anymore. And so I guess all of that to explain and to respond to your question, Trustee Doss, that you know, the leave, we have to provide it. And if the documentation never makes its way to us, there really is no consequence that has been identified in the language of this law. And in fact, I was in a meeting recently, maybe 2 weeks back, with a bunch of other HR folks, and we had we were receiving some legal counsel there, and the message was clear that you can't require the documentation, and really there is no consequence for not, if you don't receive it eventually.
Okay. Excuse me. Thank you very much for kind of going into detail on that. I have one more kind of follow-up question, and then I'm going to take a step back because I know other people have lots of questions, and I want to, be respectful of everybody's time. My follow-up question to that is, I understand that we have to complete negotiations in order to, come to an agreement, which was stated earlier by Dr. Wells, and that makes a lot of sense. However, if one of the stipulations within taking the leave is childcare, then it seems a little bit how's the best way to say it? It feels like a conflict, because if teachers have students who go to school in the district and the leave says that if you don't have childcare, then you can take the leave, then it would behoove teachers who have students in the district to negotiate to not reopen for in-person, and they all qualify for the leave because the leave speaks directly to having childcare for their student. I hope that so that's kind of my question there. And then just a statement related to this is that I would like to think that we as a district would be supportive of teachers and staff that need to take the leave for, whatever reason. I just wanted clarification around the documentation and kind of what staff needs to do in order to, qualify for it, and kind of how that will work. I thought it was important to kind of, clarify that. But I do think that we would be supportive in people, who need to take the leave, because we want everybody to be safe and make it through this as healthy as possible. But my last follow-up question is that if the leave is directly related to childcare, and we have a number of teachers who have students in the district, it seems as if that might be a little bit of a conflict. And so I'm just kind of wondering about that. And then I'll save the rest of my questions for later in the evening and allow others to chime in.
So let's see, a few things. So one, we have already had a number of staff at the beginning of the year say, given this distance learning model, because I have my own child or children at home, or especially with children, that it is very challenging. It's going to be very challenging to be able to teach, be on Zoom and support my own children, especially the young ones, while they are on their Zooms. And so for that reason, folks opted to take advantage of this leave and even year-long leaves, both part-time and full-time, just specifically for that reason. But if we were to return, say, sooner, while this leave is still available, let's say we return to a hybrid model, that means our teachers would need to be on campus at least 4 days a week so that they can teach groups A and B. But their child or children would only be on campus 2 days a week. And so what then would they do with their child or children the other days when they are in having their asynchronous days? And so what we might see is then a crisis mode for our staff, trying to figure out how and what to do with their children, and needing to take advantage of this leave, even if it's just for some of the days, 2 to 3 days of the week. So I'm not sure that that answers your question, but that's what I see as the challenge with returning to hybrid. And this leave is set to sunset on December 31st. But there are other types of leave that are bargained in our ATA collective bargaining agreement that our staff have already taken advantage of when they've elected full year leaves or part-time leaves. So that's just also something to consider and keep in mind for the second semester.
I see that Vice President Durand and Trustee Hinckley's hands are both up. I have just a very quick clarifying question, Ms. Gonzalez. So it says for 60 days, but for example, would it be possible for a teacher to apply for this leave, say at the very end of December, and then that leave would then start rolling through January, February, and March?
Asked and not answered. All the HR folks are waiting for a response to this question because it hasn't, there hasn't been clarification on that.
Okay, thank you very much. Vice President Durand, go ahead.
At this point, I'll keep it just to 2 questions, just like Trustee Doss, in the interest of other board members as well, and then I have others for later on. I guess my first question, I'd like to focus on the target dates. I just really do not understand, cannot comprehend why we're looking at waiting till December. Actually January for the TK and K group, because the county has, as we all know, is saying that the schools can reopen beginning October 13th. And in terms of saying that, you know, we're all about safety, we definitely are. And I thought even at the last painful decision we made to go remote, that was always the issue. But included in that was the fact that we were going to be getting the green light from the Department of Public Health here in the county. And that's exactly what we have now. We have a green light to say it is safe for in-person instruction. And so in looking at those dates, with TK starting in January, I don't get it because they're saying we can start on October 13th. So I would like further clarification of where these dates came from. I do understand that one, there were requirements that have to be fulfilled, which is the health and safety reopening plan. Well, our district has had since July to work on that, and there has been further detail tonight, and I have some questions still, but in general, I think we're ready to almost present this plan to the county. And then the second, of course, is working with our labor partners. And then again, I would also go back to, we knew that this was coming up today, and that we should have been working with our labor partners all the way through that time. And I don't understand if we're barely going to start meeting with them next week. And I still say that's 8 days for us to get it together so that we could actually open hybrid learning on October 13th or October 14th. So that's the first area where I really need a clarification of why the district feels they need to put those target dates into next year for everybody except for preschool. I just don't get that. And second of all, people have talked about the mental health of the staff. Well, I would just like to throw in the mental health of the parents and remind us all that since the beginning, since we made that decision about going to remote, we have had parents telling us how stressful things are for them. And we know it's stressful for everybody. That's, you know, that's a given. But the parents, once again, if we talk about our clients and talk about the children, it has been reiterated and reiterated by the parents and also by the American Association for Pediatrics that the kids are suffering. emotionally, that this is a trauma for them. And so that we need to get those kids back in school. So I would like for us to talk about, for the district to respond about the mental health of the students in terms of us saying, well, we're supporting them with remote in this way and that. But bottom line is, it seems that the kids would get a whole lot more mental support by being back in the classroom to the degree possible and having that socialization with their friends and their teacher in person.
Vice President Duran, I really appreciate your comments and your thoughts and your questions. And one of the things that really calls for great pause with the county health official stating, hey, you have the green light, you can open up. And I think a lot of people missed, hey, here's a green light, you can open up if you meet the following criteria, some of which you noted. But I think the biggest notation, one of the biggest notation, is working with the labor union. And I don't want to get into the details of that in open session and violate some labor union negotiation laws, but it's moving together, and moving together takes some time. And that's just one. And we do have some work to do in terms of preparing in all the category, some of which you mentioned, and maybe Executive Director Richie could go over some of those again, that we have to meet. That would take some time. And to put it in more context, I think our pace is consistent with all of the districts in Alameda County. And not saying that we need to do what other districts are doing in Alameda County, but it gives, I think, some understanding of how detailed and complex this is. And I think the confusion came when the county made that special announcement, school's gonna open. But everybody didn't, a lot of people didn't pay attention to the word if you meet the following criteria. That listed a number of things that must be done, and then it has to be approved by the county. So I understand the frustration of wanting to open schools yesterday and balancing that with some other issues that we didn't address, but I'm gonna put it here because they're real issues. Here in Albany, we're very fortunate. We're fortunate because we have really, really great teachers who don't go anywhere. They stay, they do their whole careers here in Albany. So we have a large, without getting into any violation of personal acts, a lot of our staff are of the age where they have pre-existing conditions. And that is a factor that we have to consider. Now, if we're going to say being safe for all, it's also making sure our kids are safe, but not at the expense of our staff being not safe. And so when we talk about safety, we talk about safety for all. And so we have to consider multiple factors in moving forward as required by law. And so it's not as simple as, here you have the green light, go open next week. Not because you had 6 months to figure this out. We've been working in a crisis 911 situation. And many of us have been working around the clock and we ain't said much about it. And so we've been taking things very methodically. First, let's improve our remote learning. We've done that. But let's face it, remote learning is significantly improved, but it could never take the place of in-person learning. And these are COVID-19 ramifications. They're not incumbent upon Albany Unified School District. And we're trying to respond best as possible, respecting everybody's viewpoints, but doing this together. And when you do it together, it means pausing and listening to everybody and working it out. And it's not as simple as many people think. It's very complicated. But the good news is we're working with our labor folks and we're trying to move in a direction where we move together. And I think we can do that. And so I understand and to an extent, the frustration of why not sooner opposed to later. Also, one of the things that was mentioned in the green light by the county superintendent, that you open in phases. And the phases, as you read very detailed, are incremental and spaced out. And so we're trying to adhere to those recommendations by the county. So we're not sitting in isolation coming up with this where you pull out the air these dates. These dates were consistent, we believe, with having space and opening and increments methodically. And also being ready to close, as New York just did, at a moment's notice when they open. And they have to close like so many other schools, and having exit plans to do that, and being able to jump from hybrid back to remote. And then articulating to a great degree of specificity, what do you do with the many, many scenarios that you have before us with COVID-19? And how do you respond? For example, when a student is reported symptoms versus confirmed, when do you close down a class, a unit versus a whole school versus the entire district? All that needs to be worked out, and it takes lots of time to work those details out. And I'm very confident we can do that. Folks have been doing some pretty miraculous work here so far, but we have some more to do. And so if anybody else want to chime in on the first question, feel free regarding target dates and why is it taking so long, before I go into mental health, which is another major big issue we have to address very aggressively. And both our families and our students and staff.
Dr. Wells, I would just like to reiterate that the checklist that Alameda County published just came out this afternoon. And so as a district, we need to make sure that we meet the criteria. There are 10 different metric areas that we need to meet the criteria of. So having just recently received this today, it is going to take us some time and effort to make sure that we can submit a plan that addresses every single one of these metric areas. Thank you.
And for question number 2, what are we going to do for the mental health of students? We're starting to have that kind of conversation. We have a negotiation session coming up, but there's been ideas that put on the table, ranging from trying to have some, as we explore hubs, some outdoor activities for our kids. Maybe, for example, ranging from dance to physical activities in person a few times a week, because we know the importance of kids' connectedness. And so we're grappling with that. And I wish we could move with the speed of lightning, but the reality is we can't. And so we try to move expeditiously in a safe environment and weigh the pressures to do this versus the safety of everyone. And so at the end of the day, as one would say, as superintendent, I have to make a recommendation to our Board of Education, and I'm going to stand fast and resolute to doing what's best for all in the spirit of safety as a priority, because I can live with making sure we protect all, but I would have a hard time moving too soon when it's not quite safe and having the unfortunate occur. And so I have to weigh that and live with that. And so I'm standing resolute and making sure safety is a priority for our district. Ms. Williams, Assistant Superintendent, did you want to weigh in on the first question before we get to the second?
No, thank you.
Okay, the second question.
I just wanted to, we lost Vice President Duran somewhere. I think she fell off the meeting. So I don't know if we want to try to get her back on before we finish answering our question.
I think we should move on to your question, Trustee Hinckley, and give Vice President Durand some time to get back on before we address the mental health. She will surely want to hear that.
Sure, she might be stuck in the general audience again. So I have a follow-up question on the timing, which is, and then another question about the structure of remote and hybrid instructional delivery. But the timing question, I guess, and I don't know if it's worth digging into this more if we want to let other board members chime in and then come back to it, is just whether, you know, we've known about the possibility of doing hubs for some time and other in-person activities for particularly students that need particular assistance. She's back. And so actually, maybe I'll hold it and we'll let you guys answer her question before I finish mine, if that's okay.
Vice President Durand, we were tabling the second question until we have you back. And I know we've been having technical.
I don't know what happened, sorry.
But we're glad you're back, thank you. The second question, what are we doing for mental health? We're exploring some things that we might be able to do within our capacity. And we're looking at trying to entertain some connectedness with our kids, maybe several times a week, ranging from, with some in-person like hubs, ranging from, for example, PE, hiking, yoga, dance, yoga. Must be hungry, yogurt. And in those kind of in-person where we can get our kids connected, because we know that their mental health is suffering. We were not, this is not a healthy situation to be isolated from your peers and colleagues all the time. And so we're trying to make that a priority and fast track that in the spirit of hubs or something more creative. Of course, it warrants more discussion and agreement moving forward. And so that's where we're at. I'm going to ask that my other two colleagues, both Assistant Superintendent and Executive Director, Richie, feel free to chime in with some of the questions because you also have some perspectives as we discuss at the table.
Thank you, Dr. Wells. I'd just like to contribute that just yesterday, we met as a wellness committee, and one of the auspices that we are determined then to prioritize is the mental health and the social emotional well-being of our students this year. I believe this is a board appointed committee. I want to thank Trustee Doss for joining us yesterday, and I know that Trustee Clark is also a member of that community. I also want to thank our student board member, Audrey Mallah, for joining us. And again, that committee led by myself is also inclusive of our mental health team. In fact, our coordinator, Shelley Ball, is a standing member and has been for the last 15 years. So that wellness committee is off and running, and we intend to make that a priority in terms of our feedback to the community and our suggestions to the Board of Education and our superintendent. That's the wellness committee. Thank you.
Well, I want to get back to a point that I wanted to make sure everyone understood. The target dates are just that, target dates. The ink is wet. They can be moved. So I wanted folks to know these are target dates. The ink is not dry. The ink is still wet.
In the interest of time, I think that we should go ahead and answer Trustee Hinckley's question and move on to Trustee Clark's.
So thank you. So we don't need to answer my timing question. I think I'll just express that I would like at some point to hear more about the hubs and then the preschool childcare timing, given that we've had a lot of conversations about opening preschool and childcare previously. So I know some of that planning has been done, but maybe we can have a discussion about these dates after everyone has had a chance to ask their questions. So my main question is about a little bit more detail about the delivery of instruction in the hybrid model and also the remote model for families that would choose that. So I just want to summarize what I think I heard and then see if perhaps Assistant Superintendent Williams, you could give some additional detail. So for the hybrid model, kids would be in school 2 days a week. That part seems clear. The other 2 days, when their other half is in class, you mentioned that they would get some asynchronous and possibly some synchronous instruction. So if you could explain what that means. And then the 5th day, they're all together having a day that's similar to what they're doing now, was my understanding. And then the remote group, that if families chose that, for whatever reason, they're not comfortable sending their kids back to school. And I know in some districts, the percentage of families choosing that has been, you know, on the order of 30, 40%. So it may not be an unsubstantial number of kids. And my understanding is that they would have no further contact with their current teacher. They would move instead into a different group of kids. They would not be interacting with a certificated Albany staff member. They would have all asynchronous learning with some live interaction with somebody, which is part of what I'm asking for detail about. I just wanted to get a little bit more clarity on that, because I think it's important that we understand what instruction is going to look like for kids after, you know, after however this sort of operates when we pivot.
Yeah.
Thanks.
So yes. So first, to answer the question about what is happening on the 2 days when students are in class. So when we sort of were proposing and thinking about this idea back in July, our sense of it was that students would be in class with their teacher for 2 days, and then everybody would be participating in some type of remote, as you said, on Wednesday. And then Thursday, Friday, sort of our initial thinking, and this is, you know, last month, a couple months ago, that then students would sort of complete assignments, work independently, that work would be more asynchronous. One of the things that we discovered sort of since launching this remote enterprise in the fall is that we've been able to leverage our staff that are not sort of in the classrooms providing general ed instruction. So as I said, PE specialists in music and science for 4th and 5th grade. So our thinking now is that on the days when students are not actually in person receiving instruction with their classroom teacher, that would be an opportunity for them then to receive instruction remotely, or synchronously or asynchronously, and maybe even sort of thinking about the possibilities for in-person interaction, recognizing that we want to maintain sort of appropriate physical distancing on campus and not unintentionally sort of bring everybody back onto a campus when that's not the goal, that then students could be served by these specialists. So so they might have PE on a Thursday or a Friday. They might have music on a Thursday or Friday. They might have science if they're in the 4th and 5th grade and elementary on a Thursday and Friday. And that really sort of came out of new thinking. That really came out of sort of the success of leveraging those specialists in this current format of remote learning, where we find, so my own personal example, on Wednesday when my 4th graders teacher is, after she meets with her in the morning, she then participates in library, and then she participates in PE. And so that's a really great way, we thought, for students to continue to be connected to staff sort of in some type of live interaction. Because I think while we might, you know, sort of our older students, secondary students might be able to sort of self-manage, self-regulate, sort of pace the assignments that are given on the days when they don't have in-person instruction. I think we recognize that that would sort of be infinitely more difficult for students who are in the elementary grades. So to the maximum extent possible, we want to ensure that they are having some kind of significant engagement with staff in their asynchronous days, in their not in-person instruction days. So it doesn't sort of wind up that they have 2 days of instruction and 3 days of sort of being on their own, right? Because that, I think, could be really, that could be really disruptive to the cycle of learning, right? Because right now, even though it's not an optimum situation, they are with their teacher, their general ed classroom teacher, you know, five days a week, right? They're with their teacher 5 days a week. And in this model, they would be going from 5 days to 2 days. And so our goal then was to try to find some way for them to continue to have some significant, as I said before, connection to AUSD staff. So that's what our thinking is around the non-in-person instructional days for students. And then the Wednesday would function as it does now, which is sort of like a shortened interaction, like a check-in with the teacher in the morning, give you the assignments, and you're sort of on your own. And then we would, I believe, continue to use that time. Wednesday pre-COVID was a shortened day, a minimum day, where there were opportunities for staff meetings, and so we would want to honor that time. We've really been maximizing the Wednesdays for professional development. We'd like to continue to do that as teachers are transitioning to this partial in-person instructional model. So that speaks to the first question that you asked. Was there any other information I could provide in that regard? Cool. So then the second question, the second question then is about how we are thinking about providing remote instruction for students who are opting out for the many reasons that they might. So, our elementary principals sort of on their own, and we appreciate it, sort of have begun to sort of begun to ask this question, right? Sort of casually, like, depending on the model, sort of, do you envision that you would participate in hybrid or remote? And we know that we ask that question sort of absent of context. And so we're gonna be, I believe Dr. Wells has information to share about sort of re-engaging with the community after they've received this information to sort of find out, what their interest would be in participating in remote instruction. So our thought about sort of not having teachers provide this hybrid, sort of preparing for hybrid instruction, and then also preparing for remote instruction is to avail ourselves of online curriculum that's organized, that is grade specific, that is standards based, that students could avail themselves of while they're choosing not to be in school. And then the idea about sort of how we will support them, I think, is continuing to evolve. But I think what we're thinking about that is that, if, for example, there are some staff members who cannot be on the campus for whatever reason, there would be staff that would be available. I sort of think of it as like case management, progress monitoring of students, but not teaching content, because we might end up with a scenario potentially, and I don't know till we find out more information from parents, but we might find that we sort of have a range of grades that don't sort of split themselves perfectly, right? So a teacher couldn't be, sort of developing, creating curriculum and then delivering that curriculum for sort of, multiple grades, even 2 or 3 grades would be quite a bit. And so then the idea of using sort of a pre-purchased curriculum was that then students would get sort of, robust grade-specific curriculum. And then the role of AUSD staff would be to sort of provide support for students as they progress through that curriculum. So that's what we're thinking about that. I think you asked a question also that I'll sort of answer here about how that would work for secondary. And I actually think, we've had some experience, more experience certainly, with remote instruction for secondary than for elementary. So we're sort of taking what we know works at the secondary level. So for example, we use BYU's UCCSU approved courses to provide instruction to students remotely. And so that's for a host of reasons, for credit recovery and or because, students have some need to, sort of explore an area that's not provided, maybe specifically in their coursework. So we do have some experience and success with our secondary students using an online curriculum, and I would feel really comfortable and confident in being able to sort of facilitate and arrange that for students with the support of the high school. And so I think sort of our best thinking at this time, just to close, for elementary, is that we would provide them with the content, and then our sort of piece would be to provide sort of support, I'll say case management, progress monitoring, but not teaching. But then you also said one more thing, sorry. You talked about sort of students not being able to sort of have interaction with their class, not being able to have interaction with their former classmates. And in fact, just yesterday, I was talking about this sort of very question with principals, and we were sort of problematizing that, right? Like, what could that look like if a student weren't participating in the in-person instruction? What would the opportunities be for them to participate in sort of social emotional activities happening at the school? And I think it sort of would depend maybe on the reasons that the student was self-selecting out, because if they're self-selecting out because they have grave concern, about contracting COVID, or they're in a situation where they don't want to expose themselves, then, they might not want to then sort of, be participating in in-person activities. I don't think we've closed the door to that. I think we're sort of just continuing to think about how we might best serve the many needs of our students in these current conditions. So does that answer your question at all sufficiently?
Yeah, I mean, there may be a longer conversation to have in general about secondary, but I think that's not really the focus tonight. Yeah, I just wanted to be clear, and especially for families that are out there sort of thinking about their own comfort level, what school would look like for these two different groups as we pivot. So the only thought I'll leave, and I know Trustee Clark's been waiting patiently, but I myself haven't looked into what other districts are offering for that remote group. I know many districts already made parents commit to one path or the other. But at some future point, I'd be interested in knowing more about how other districts are managing it. But I don't need a response. Thanks.
I would like now to move to Trustee Clark, who has been very patient.
Yeah, thank you, President Trutain. I just want to speak as one board member. There is a few things that I would like to bring up as well. It's already 7:45. This meeting is supposed to be scheduled till 8. So in my opinion, this meeting definitely needs to be extended. We have 274 people waiting. And I would hope that sooner rather than later, we can actually hear from the public. Thank you.
Okay. I think we should extend. Trustee Clark, would you like to make a motion for that extension?
Can you refresh my memory on our new guidelines? Because this is in extraordinary times. So this meeting, I don't think should fall under some of the same guidelines that we had talked about as far as trying to have efficient board meetings. This is not a normal board meeting. So I don't know, like, are we limited to one, or can we have two different extensions? Because this needs to be thoroughly discussed, in my opinion.
Okay, so there's the issue about this being a special meeting, and I think that the board bylaw that we passed agreed that we could have 2 extensions of 1 hour each, but we would do them, sequentially. So if you were to make a motion, it would be for a 60-minute extension.
Well, and that's also for, I believe you said something about regular meetings. Those were 3-hour meetings. So this meeting was already only at 2 hours, and whatever guidelines.
Yeah, I mean, I think we should just,
I'd rather do my extension at 8 o'clock. If I do it now, it's only 7:45.
I agree with that, because then we can still discuss until then.
oh, well, we could go ahead and make the extension now, just have it be from 8 to 9, just motion that we extend the meeting from adjourning at 8 to add a 60-minute extension to that. And then if we get close to 9, we can add another 60-minute extension to that.
Cool.
Can I add something really quick? Based on Trustee Hinckley made a comment. I feel like that was I was the one that made that comment. Trustee Hinckley made a comment about the hubs, and that we had mentioned them on more than one occasion, and that we had talked about them, and that they have actually been approved by the county for a number of weeks now, that we could actually have those hubs in place. So as a board, I'd like to discuss if we could determine a date that we feel comfortable with tonight, and then give instruction to see the hubs formed and take place by that date. I think it's fair to the community because I can only speak for myself as a working parent with multiple children in the district. It's really hard to talk to your employer and explain to them what's happening and to be an effective employee when you don't have any idea what's happening with your students. If they say, well, when are they going back to school? I don't know. Or are they going to be on campus sometimes? I don't know. Or are they going to do, I don't know, when it's safe to do so. And then they sent out the saying to the October 13th date. So that was a date that many people saw. And then based on my notes, we specifically said that we will be following the state and county recommendations. Well, the state and county recommended that you can start in-person learning as of October 13th. So I think the board, if we could discuss tonight and take action and give a recommendation and give instruction as a date that we'd like to see that happen, because we've been hinting at it and talking about it and asking for it for a while now, and it seems to just bounce from meeting to meeting, but we haven't given any dates. And I'm not sure how we expect parents to formulate any plans if we don't give them dates for them to work with and for them to work with their employers on, so that everybody can, have a plan in place. So I'd like to discuss that as a board this evening and come with some concrete dates to give instruction to staff.
I hear you. So I think that question should go back to Superintendent Wells about having a discussion now about hubs. I'd also like to hear from our student board members tonight. And of course, we also want to hear from our community. So all of those things need to happen. Dr. Wells, would you like to talk about the district's plan for opening hubs?
Yeah, Trustee Daltz is correct in the sense that the county has given us the authority to move forward with hubs. But there is another piece. Moving forward is something you have to do together. Again, like most negotiated agreements, ours no different. You cannot mandate staff coming back to do hubs. And so it's not as simple as, hey, we have the authority to do this when there is no authority given to do this just yet, absent of having it negotiated, because mandated is something that we don't have the authority to do at this point. And it's important to share that so that people are completely informed with the parameters in which we're working in. Typically, I think we're used to having a supervisor, and a supervisor gives instruction and it happens. Here it's very different. We're under an emergency issue, and we don't have the authority to mandate folks to come back and do hubs in the pandemic right now. And so we have to work with our labor folks to have hubs as part of an agreement moving forward, because currently right now, again, we don't have the authority to mandate it. And so we can say, the board can say, like other boards, I want this done on this day, and then found out that that day come and nothing happens because you can't do it without staff. And so it's best to work with staff in doing this. And we're stepping up our efforts to work with staff to try to get hubs best we can. And so it's a working together, and it's not happening overnight. And I understand the frustration, and these are not normal times. These are extraordinary times. And we have parameters and purview, and we don't have the authority we thought we have. And I think I need to be clear about our capacity and the rules we have and what we can and can't do. And so, yes, the board can say to the superintendent, I want hubs next week, get them up and running. And I can tell you, absent of working with your labor union, there will be no hubs and up and running because you can't do it absent of no staff, or absent of staff rather.
Okay, I think that, excuse me, Trustee Clark, I still see your hand up. Did you have another comment?
No, I didn't take it down, but my initial request was to hear from the public, and we still haven't got there yet.
Okay, so I think that, attendees, please know that you can raise your hand and we'll have time for public comment. And we'll begin with Ms. Sonia Herbert. Please go ahead. Sometimes it takes a minute to get, there we go.
Hi there. Thank you so much for all of your hard work on this. I know it's an incredibly hard time, things changing every day, and I'm speaking as a parent and as a teacher and as a public health professional, so I know all the things you're trying to juggle. I have a long list of things I want to talk about. One of which, though, is that this is a plan that needs to be based very specifically on Albany's terms. So I want to hear more about if you know how many teachers are willing to come back and in what situation. I think polling the union and having a labor report to the board would be very helpful. As a parent who is in a situation of an immunocompromised family, I have to say I am really offended by the language of students who self-select to stay home. You would never, ever use that language with a student who has learning disabilities. They are self-selecting to not participate in formal education. You are making an argument in this plan that online instruction is not good enough, even with the incredible creative and dedicated work teachers have put in. And yet when it comes to students who will have to stay home or risk the lives of your family, you're willing to say that no live instruction for a teacher is valuable. And all of my other points are going out the window because I'm so deeply offended by my school district making that point. You know, as a teacher, I can't believe you would just cut students out because they can't, for health or personal reasons, attend school, when the larger argument is this is for the emotional health and educational success of students. And I'm going to cede my other points, but I'm deeply offended by my school board making that assumption.
Thank you, Ms. Herbert, for speaking. We'll move on to Joel Ervice, please.
Can I comment on that last speaker real quick, President Trutain?
Sure, go ahead.
I'm not sure if she meant it, but she said the school board had made that or staff made that comment.
I think she said her school district, so I heard district.
Okay, I heard board, and I didn't make that decision.
Okay. Yeah, she might have said it a few times or said it different ways. So you're, it's very possible that you're correct. Yeah, I don't think anybody on the board said self-select. So let's move on now to Mr. Ervice. Go ahead, please.
Can you hear me?
Yes.
Great, thanks. So I'm a parent of a Marin third grader, and I'm strongly opposed to shifting to a hybrid model for all elementary school students without a remote option that is at least equal to what's being provided now. If the current system is not working for high-need students like those with IEPs or students without housing, then let's absolutely make changes to help them while keeping COVID risks low. But for the general student population, making such a major change will unnecessarily increase COVID-related risks for all students and families. I want to focus on one serious concern about the plan, and that relates to ventilation. Not a particularly exciting topic, but it's critical. The plan mentions that the district has upgraded its HVAC to use better filters. That's a great start, but we have to have excellent ventilation too. There is strong and significant evidence that shows an association between ventilation and the spread of infectious diseases. You basically have to get more fresh air into buildings to dilute the concentration of any infections. And I am simply not confident that the HVAC systems in our schools can provide sufficient ventilation to reduce the risk of COVID. 2 of the school facilities are quite old. Additionally, study after study has shown poor ventilation in schools. There was one study in 2019, so a year ago, that showing that 94 recently installed HVAC systems in California's K through 12 schools, of them, 85% did not have adequate ventilation. So I want to know if the district can be confident in its own systems. How do you know? When was the last time the HVAC systems were certified as having adequate ventilation by a qualified third-party professional? Do you have protocols in place so that a teacher can't shut them down if they're too noisy? I think are they will they be running before school starts to clear things out and all day long? Until you have all of these and many other issues answered clearly, I think you should not elect to send the general student population back to in-person learning.
Thank you, Mr. Urvais. Now it is time for me to ask the board for a motion to extend.
I'd like to make a motion to extend the meeting for 1 hour from 8 to 9 p.m.
Thank you, Trustee Doss. Is there a second?
Yeah, I'll second Trustee Doss.
May we have a roll call, please?
Student Board Member Corzo Clark,
Yes.
Student Board Member Mala,
Yes.
Trustee Clark,
Yes.
Vice President Duran,
Yes.
President Trutain,
Yes.
Trustee Hinckley,
Yes.
Trustee Doss.
Yes.
Thank you.
Right. The motion passes unanimously. We'll move on to our next public speaker, who is listed as guest.
Can you hear me now? Hello? Can you hear me? Okay, I'm sorry. Sorry, this is Stephen Naif talking with for Stephen and Chris, our HTA co-presidents. A quick response, if I may, to the leaves, and then I have a little prepared statement. First, in response to the leaves, I have to say I'm really dismayed at the lack of positive intent around the discussion for our federal and bargained leaves. Taking a leave is a difficult and agonizing decision that teachers must take, often with reduced or no pay. Teachers take leaves because they have to, not to opt out of teaching. And then our statement. Good evening. For the past 8 weeks, our teachers have been providing the best remote learning experience they can. Using a variety of video and technology tools, along with whole class, small group, individual, and asynchronous teaching, we have sought to engage students while also dealing with issues around technology, emotional health, educational best practices, natural disasters, and of course the pandemic. Teachers have been modifying in-person curriculum to try and fit the constraints of remote teaching and spending countless hours making asynchronous lessons. To be honest, it is exhausting. All of us know that this is not an ideal teaching situation. Even as we try our best, we know that just as some students are flourishing, others are being left behind. Along with parents and students, we look forward to being back into the classroom safely. Safety is always of primary concern for educators. Children need to feel safe or they don't learn. We need to feel safe in order to teach effectively. Currently, safety is literally a matter of life and death. While we're excited to begin a process of eventually bringing staff and students back to school, there are many issues that need to be addressed. The ventilation being one of the most important, actually. Safely reopening our schools will need to be based on science and readiness. And we ask that being permitted to open not be confused with being prepared to open. As the district will need time to complete and implement a final reopening plan, we will need time to bargain in good faith for our members and what we believe is best for our students. We understand the hardships that everyone faces in remote learning and are just as anxious to see children back in the classroom safely. Sincerely, Stephen and Chris, ATA co-presidents.
Thank you very much, Mr. Naif and Mr. Knight. We move now to our next speaker, that would be, I can't see the name right now, Mr. Okimata.
Yeah, hi. This is Eric Okimoto. I'm father of 3 kids in Cornell Elementary. My question is about the remote option that was discussed earlier. You know, we have elderly parents with compromised immune systems, and you know, obviously there's lots of other reasons people could be in that situation where they decide to choose remote learning as an option. But it sounds like the remote learning is going to be quite a bit different than it is now, and quite a bit different from the experience those that are in class will have. And so, you know, my question is whether or not consideration was given to conducting the remote learning in parallel with the on-site learning. Meaning, has anybody considered, you know, putting cameras and microphones in the classrooms and, you know, allowing for the teachers to teach in person while also providing a similar, if not the same, experience to those that are participating remotely? That's pretty much it.
Thank you so much. I think that in order to get through all of the public comments, that we'll need to have staff address these at the end. So I'm anxious to hear the staff response to that. But at this time right now, we'll move on to NAM Trita Luxana. Thank you. Nam, you might be muted. We're not hearing you. I think we're having a technical difficulty. I'd like to go ahead and until we can work that out and move on to the next speaker. Amy Appel, please.
Hello. So I have a number of comments. My first one goes back to Dr. Wells's initial slide about planning for in-person learning, having a plan ready to go when we are called upon to do so. I would say that we are calling upon the school district to do so, especially for students with disabilities and other high needs that need to be in person and interacting with school district staff on a one-to-one basis. My second comment is that I would really like to know what the target date for these in-person services to IEP and 504 plan students. Is it November 5th or is it sometime later? I'm not sure what the district staff means by school age hubs. So I'm hoping that that would include the students with IEPs and 504 plans. So one other question I have is that the question of the MOUs has come up a number of times in the discussion as a reason for delaying the later grade levels. But it seems to me that if the MOUs are going to need to be resolved in order for the preschool staff to return. So I'm not sure why that would be a reason why the other grades would be delayed for so much. Especially since the high school and middle school students would have to wait a full 2 months after the elementary students would be back on campus. And my final question is why the negotiations with the unions did not begin months ago for the return to in-person education, because it was clear that we would get to this point eventually. Thank you.
Thank you, Ms. Appel. We'll go on to Leila Aranjani.
Hi, everyone. Thank you for the time to speak. Myself and my husband had been intently following for many months and would speak, but eventually felt our efforts were fruitless. So we kind of just accepted what was being done and held on to this October 6th date for a decision. Now, in hearing these tentative return dates, we're astounded that our daughter will have been out of school for exactly 1 year before getting to return, and then it will be returning only part-time. We won't reiterate how this seems completely labor-focused at the cost of our children's education, development, and parents' livelihoods. We know our daughter's teachers are trying with the tools they have. However, what she has learned in 5 to 6 weeks could really be learned in 1 to 2 days. She's not challenged at all, and so much of the time spent in classroom group effort to resolve technical problems. What we want to express is that in following what this district has done in states, it's clear that there is so much pontification happening and no decision-making occurring. I heard tonight about work groups and committees, and they're all great to generate ideas and ensure all voices are heard. However, they are nothing without a product. It's been 7 months, and what is the product? Because everything said by the district is tentative and not clear and is still being discussed as we hear in these meetings. We request that the board start insisting on decisions and implementation by the district, as there has been more than enough time to plan, and the leeway has been more than gracious by this board. We all know what time we've been in for the last 7 months. As part of a public health for the county, I have an inside view of what other schools have done to create and implement education for children, and they've done so in a safe way. It is doable, it is being done. So what is going on with Albany and the lack of a plan and product? We also want to finally encourage the district to consider 6th graders as elementary students, as they can be according to the county, and plan a return date of the 6th graders to the middle school campus to get acclimated at the same time elementary students return. Thank you.
Thank you. We move now to Cheryl Thies.
Thank you so much. I want to express, first of all, my appreciation for all the hard work and commitment that goes into this kind of work, and I know it's not easy. But I want to mirror our first speaker this evening. I'm deeply concerned and frankly offended by the way the proposal or decision, and I can't tell which one it is, that students who cannot safely return would participate in a very different program altogether. First of all, I trust parents and families to know what's best, and I don't see these as choices. In most cases, these are necessities to keep people safe. Families operate as units, not as individuals. So whether intentional or not, this decision or proposal may have a coercive, punitive impact. Parents may risk themselves, their loved ones, and their children to keep their children's relationships with teachers and friends going, to get their children's mental health needs met, because as you said at the beginning, this is an emergency. So they will be torn between whether to accept a completely alternative track of education or take these risks, and I see that as coercive. I have, as an education advocate, worked with many, many families whose children are participating in these online programs. They often sell a bill of goods they can't deliver. They're all remote, they're fairly robotic. Their kids will tell you they're often very boring. I know about the credit recovery options. They're great options when a kid really gets credit deficient. They're not a quality education. I see problems with students being isolated, disconnected. I'm concerned about students with IEPs. Basically, you're saying if they're not safe to return, they would not participate in any of the benefits of an Albany unified education. It's not acceptable. I'm offended. I'm really upset, and I hope you take this proposal off the table. Thank you.
Thank you. We move to Elizabeth Allison.
Okay, there you go. Hello? Okay. Hi, thank you. I am the parent of a 3rd grader at Marin Elementary. I'm also an educator myself, and I'm teaching online this semester, as I have been since March. I am also quite concerned about the distinction between the hybrid model and the 100% remote model that sounds at this point like it severely disadvantages the remote students. I'm particularly concerned that it doesn't appear to meet the state mandated requirement of contact hours of 240 minutes, I believe, for elementary students as of this summer. And I would like to say that the third grade teachers at Marin Elementary have been doing a tremendous job. Of course, it's not the same as being in person, but the third grade team has worked together to create a very robust plan for all the third graders. And I would really hate to see all their hard work fly out the window. But I need to echo the previous speaker and also the first speaker in saying that families with anyone who is immune compromised in any way, which can include any adult over 50, as well as anyone with other kinds of health conditions, may not be able to send their kid back to hybrid school. And so those families will be pitting their health against their child's education, and that's not an appropriate decision to be making. So I'd like to ask that the remote students get synchronous instruction from Albany school teachers, and that be provided at the same time as those hybrid students are getting their online instruction. I don't see why the remote students couldn't join the hybrid students in the online section of the classes. The remote students must get synchronous education to live up to the state mandated requirements. Thank you.
Thank you.
President Trutain, I've counted a number of speakers asking the same question. I think we need to clarify because we agree with them with the remote. And I want to be crystal clear about something. Those who are medically and can't make it back because of medically or for other reasons, they can still get and should get an Albany Unified School District teacher. And when they're cleared medically, say that they are, for example, they too can come back into in-person. The distinction was those who opted out with no medical, just opted out because they wanted to stay as a, we were thinking as an additional options family may want. But those who are special ed and medically fragile, they get, will be able to get a teacher, Albany Unified School District teacher. But those who opt out, we would want to go with a state approved program for those. But it doesn't preclude us from going back to reconsider how we might do that, whether or not we're going to stay with a state approved distance learning program or seeing whether or not we have the resources to address, depending on how many students opt out for reasons other than medical or special ed. I wanted to clarify that because we were hearing the same concern around remote learning for medically fragile and special ed kids.
Could I just ask for a clarification on that though? So, because I think that speaks to some of the frustration of the first speaker, which is that families may choose, families may decide that it's not safe for them to send their kids back to school, not because the child themselves is medically fragile, which is the exception you've created, but for a whole host of other reasons. So could you maybe clarify the statement you just made about what is the group of kids that you're envisioning would be eligible for instruction by an Albany teacher in some remote fashion versus who you're defining as opting out? If you could explain how you're thinking about those two groups differently, I would appreciate it.
Yeah, I think we need to go back to the premise of the ink is not dry. One of the things we wanted to do is hear from our parents and the board about very specific components of the plan. And if there were some things that stood out that needed to be adjusted. And it seems based on what I'm hearing, and as we rethink this, that we need to make some adjustments and continue to do what we think is best for our kids and figure out how do we, and be real, what kind of capacity do we have? What kind of creative thinking can we come up with for these areas? Because every parent, including myself as a parent, would want a Albany Unified School District teacher, even if my family decided to opt out. So we need to go back to the drawing board on this issue. We heard the families loud and clear. I think we agree with their sentiment and want to be able to adjust it whereby people have a live person opposed to an instructional program. Now, as we did our studies and looked at the school districts that were opening in the Bay Area, Marin, I believe it was Marin, Palo Alto, Menlo Park, in their plans and research, they adopted a state-approved program for opting out, and that's what they had, and that was their black and white. We don't need to be like that. We could be more flexible if we have the capacity to do so. So we want to kind of come back and revisit this for those, that group you just described, where you said parents don't feel safe, and say you have 500 of those parents. Well, we have to come up with I think, a contingency plan of how would we address 500 plus kids who's opted out. And so that means that warrants more discussion. And I would like to have something more concrete, but I want to say I heard from the families, I heard from the speakers, and I hear, I think, how the board feeling about this, coupled with how we need to go back to the drawing board on this to look at a number of different contingencies. Because, for example, if we have 500 kids opting out, how many teachers we might have free to address that 500 kids? So it looks like it may need a creative solution for a number of different scenarios, but I want to be clear on this issue. For those who are in special ed and those who are medically fragile and can't come back, we'll have a teacher working with them remotely. So I want to delineate at least between that, and it looks like we have a little more work around what we can do, and also being honest with ourselves about our capacity if we have 500 kids to 1,000 kids opt out for reasons that are not medical, but families don't feel safe.
Thank you, Dr. Wells. I appreciate that clarification. We'll move back to public comment. Abby Petzold, please go ahead.
Yes, I actually am Jessica Petzold. I have two children at Cornell, 3rd and 4th grade, and I actually also echo a lot of the speakers, especially the first one. I am deeply concerned that because of health issues, students who choose remote learning are at a disadvantage because the resources are not allocated equally. While families who elect the hybrid model would get support from regular teachers via live teaching, the remote students are not getting any support and is cut off from their peers and teachers completely. And if I heard correctly, music teachers or maybe even PE teachers will fill that need. I love our specialists, but I think they're awesome, but I don't think they're a replacement for their regular teachers. I want to encourage you as leaders to explore other options that will have parallel learning between the hybrid and remote learning groups. What about simulcasts? It seems like the teachers are going to be teaching half day for 4 days in the hybrid mode, and they have half of their days free. I can't understand why the teachers can't in the afternoon support their remote learners. Thank you. That's all I have.
Thank you. We'll move to Patrick Buffard.
Yes, hi. We're parents of a Marin 5th grader, and echoing a lot of what the parents are saying, we're leaning very much towards keeping and opting out in the virtual. And based on the proposals, it doesn't really seem like a very good option for us right now. And I almost feel pressure to go to the hybrid model just based on the lack of teacher interaction. I do have a couple of questions. First of all, I'm curious what, based on the first survey, what percentage of parents or families said that they would opt out? And if that informed this proposal, I would have hoped that if we're in the 30%, 40% range of what Trustee Hinckley had said earlier for potentially other districts, that perhaps another proposal for all virtual could have been maybe a little bit more creative upfront. And then I think too, if you're going to have a second survey and it turns out that there's an opt-out rate that's pretty high, that rather than having no option for a teacher certified connection to the kids that are virtual, that you could maybe balance out the classrooms again, so that for those kids that are virtual, they can still have a teacher, and that for those that are in person, that they'll still have a teacher as well, so that there is a better option for the kids that remain. And then as a parent that's trying to make a decision based on what was proposed, if I understand correctly, right now the proposal is that there would be a learning management system, or sorry, learning management system. Can you give more details on what that is so we can better educate ourselves that when we're doing some research? And the question is too, also for those that are virtually opting out for the virtual, what happens for the kids, for those kids that are for physical education, for the music and science and arts that are not with the core teacher? And finally too, what is their criteria for the hybrid model to go back fully virtual? Like, what is the criteria to then shift back? Those are my answers or questions. Thanks very much.
Thank you. We'll move on to Eric B.
Hi, thanks very much for the opportunity to talk. I'm the parent of a third grade Marin student, sorry. And I just wanted to reiterate what a lot of other speakers have said, which is a real frustration with the remote option that's being offered. And I really do resent this opt-out framing for families who have other members of the family besides the student who has a serious medical condition or other good reasons to avoid exposure to coronavirus, and the differential death rates that result depending on the age group you're in and your prior medical condition. And I feel like the way the structure is designed right now, you're forcing parents and students to choose between a quality education and their personal safety. And that is not acceptable. The second point I want to make is I'm also somewhat disturbed by members of the board seeming to push to move to reopen really fast, even with all of the uncertainties that we're facing. And we're dealing with a kid at home. We're trying to work at home with our kid. I really appreciate the challenges that everyone is facing, but there's also a lot of uncertainty about how the disease is developing, what exposures are available, what risks are out there. And there's a lot of planning, as this meeting I think has made clear, and it's hard to do. And I think the worst thing to do would be to rush to reopen, and then 2 weeks later, we get a bunch of cases in the district and everything has to go back to remote, and it's a total mess. And now you have got to readjust back to the original system before, and you've lost another month of education, which is worse than having the current status that we have right now. So I really hope and wish that the district and the board would take into account the costs of moving too quickly. And I do actually appreciate the original timeframes proposed by the district staff on this issue. Thank you very much.
Before we move to the next, before we move to the next speaker, I'd like to respond to the statements there, but not respond directly because I'm very respectful of everybody's opinion, and I think that Mr. Eric B. made a lot of good points. So this is more of a general response, which is often when I speak at the board meetings, I try and make it a point to advocate for parents and students that aren't able to advocate for themselves. And I want to be very clear that everybody on this meeting tonight is on this meeting tonight because they have a certain level of privilege. You have the privilege of not having to be at work right now, so you're able to log on and participate in the meeting. You have the privilege of having a strong internet so that you can participate in the 3-hour-long meeting. You have the privilege of maybe you have a 2-parent home, so one parent is keeping an eye on the kids while the other parent is participating in the meeting. And I want to make sure that we are keeping in mind that me as a board member would never force anybody to put themselves in danger medically. I am simply myself, my responsibility as a board member and as a person of color to advocate for people who cannot advocate for themselves, for the parent that can't get on the meeting, for the parent who is struggling through distance learning and they don't have a job that allows them to be able to work from home while they help their student. Those are the students that I'm advocating for. Those are the parents that I'm advocating for. The parents that are struggling and they don't know what they're gonna do. The parents that might have already lost their job because they don't have a babysitter and their student is at home. And I wanna make sure that we're keeping in mind that there is an achievement gap that exists. And as we continue to be remote, that achievement gap continues to grow and grow and grow. And it's not because the teachers aren't working really hard. The teachers are working really hard, so are the administrators. The board is working really hard to figure things out. That doesn't change the fact that this is a struggle and there's an achievement gap and it's growing. And I think that everybody's heart is in the right place. But I think that as we're logging on to these meetings and we're performing virtually, we forget about the people who aren't able to get on and advocate for themselves during these meetings because they are struggling. And not saying that everybody has to go back to school, but we need to provide options for those who cannot do distance learning. We need to provide options for those who don't have any other option. I want everybody to, I'm gonna stop talking now, but I want everybody for 10 seconds to just take a moment and put yourself in the position of the parent who does not have the job that you have. Put yourself in the position of the parent that does not have the childcare that you have, or the food that you have, or the finances that you have. Put yourself in their position for 10 seconds. What would you do? You're counting, it is the schools, it is our responsibility to educate all students, not just the students from privilege who come from a place of privilege. It's our responsibility for all students. So we need to develop a plan that is going to help all students, not some, not most, not a high percentage, but all. And I hope that we keep that in mind as we move forward. Thank you.
Thank you, Trustee Doss. We'll move on to Rachel Chapman.
Hello, can you hear me?
Yes.
Okay. I am the parent of two children in the school district, one in elementary school and one in middle school. And really, I am very frustrated because the board decided the decision back in July was for hybrid, and it is inexcusable why there has not been a survey of teachers who would be willing to come back, why you don't have an basic information about parents that would be wanting to send their kids back. There's no plans. It is really, really hard. There's lots of very difficult, hard, and important decisions that need to be made, but constantly kicking the can down the road is just not acceptable. You know, we talk about, it's very frustrating. And I appreciate what Brian Doss just said too. You know, I am very blessed to have a job that is allowing me to be very flexible. And I am blessed because I happen to have a degree as a teacher, but I'm telling you that my child is an African-American child who will not meet grade standards unless I spend significant amount of times with her. And she has a fabulous teacher. She has all of the supports. We have, you know, internet, we have all of these things, and I am barely able to keep her up to standards. There are a lot of kids who are falling behind for a lot of reasons. And it's very frustrating to hear, oh, well, we should think about this. We should think about that. There needs to be a plan. There need to be time limits. There need to be decisions made. They're hard decisions. I believe everyone is operating in good faith. I think everyone is caring, but not deciding is saying that we're going to be remote all the time. That's the decision you're making. Thank you.
Thank you, Ms. Chapman. I think it might, so it's 8:30 right now. And I think that I would like to bring it back to the board briefly to ask about a few specific issues. One of them is I've heard a number of people mention the idea of a new parent survey, getting an idea of how many parents would would choose a remote only option. You know, and maybe we need to phrase this in a couple of different ways. You know, like, would you choose a remote only option with one of these online services as were described in the plan? And I know that we were also asked for some more specific information about, you know, exactly what that would be. I don't know if there's any particular ones that are being considered. You know, and also we've heard a number of people mention that we need to get an idea from our teaching staff of how many of them would not feel safe coming back for in-person teaching. So that, you know, rather than have people continue to bring that up, I just wanted to survey the board to see if there was a consensus that we would like to ask the district to do both of those things, a new parent survey and a new teaching staff survey. Okay. So I'll just do a quick ask. I'll ask our student board members first. Student board member Mala, how would you feel about those two requests to the district?
Yeah, that sounds good.
Student board member Corzo Clark?
Me too.
Yeah.
Yeah.
Okay. I'm just going to go through the way the profile pictures are on mine. Trustee Hinckley, would you be in favor of that direction? Okay, I saw hands up. Trustee Clark, would you be in favor of those surveys?
It depends how they're worded. Right now, the full remote, the way it's being proposed, we're hearing that people are going to say no. We heard Dr. Wells said that might have to go back to the drawing board. So surveys take a while to get the information back. And if we haven't decided what that model is going to look like, I don't see the usefulness of that particular question.
I was thinking that maybe we would ask that they say, you know, give a couple of different remote options. You know, would you select remote if it were if an AUSD teacher was not involved? You know, and then an additional option, would you select remote learning, you know, if there were AUSD teachers delivering the curriculum? So that way I think it would be, you know, it's a worthwhile differentiator there. I'll go to Trustee Doss. How do you feel about the survey question?
I think the survey question would be good. I agree with Trustee Clark that the wording, I think, needs to be very specific so that we don't have to do continuous surveys. If we're very specific in the wording, we can really get the feelings of both the community and the staff.
Okay, thank you. And Vice President Durong, how?
I hate to make this a little longer, but I'm going to, because in many of the resources that were sent to us by the district, I looked up, or it had Ed Code section 43503, which refers to distance learning. And it basically says that the governing board shall develop, with parent and stakeholder input, an alternative plan for frequent live interaction that provides a comparable level of service and school connectedness. So, you know, if we have a concern, and I certainly did, about the type of remote learning that we had described, or that had been described in the draft that was sent to everybody, this really puts it to say, no, it's not about getting a service from some remote place, that it's really the section, the Ed Code says 43503 provides a comparable level of service and school connectedness. So to me, that's certainly providing the district with a direction that will really speak to connecting the parents and, I mean, the kids, so that the parents don't have that concern that has been expressed tonight. But in terms of the survey, at the same time, I don't have an objection to it. But as long as this understanding is there for everybody, and that there is an Ed Code that addresses it.
Thank you very much for looking that up. That's very informative. I'd like to bring it back to Dr. Wells, whether he would like to speak to this or ask Assistant Superintendent Williams to. What is the admin view?
I think we can do both. I think one is clear, and as we look at it from a common sense perspective, and taking our time to do this right, is that when we look at the remote, we look at it in a sense of what we know to be best for our kids. And as I'm sitting here reflecting, although there are some remote approved programs out there by the state that get thumbs up, it doesn't take the place of having a teacher like we have here in Albany. And so we heard from the parents. That's the purpose of the board meeting tonight. We got their input. We heard from some experts. And upon further reflection, we'll move back to the drawing board and look at options that include a teacher. And so I think with some creative solutions with a number of our stakeholders, we can come back with something more palatable for all kids who may be in remote, even if it's super challenging with a lot of kids. As we were thinking about this earlier, about 6 weeks ago, we came up with what we thought might be a creative solution. And I think I got one of the ideas from one of our staff members when I was out visiting sites, and that is, if there is a remote option where people opt out, we also have some teachers who may not be able to come back because they may be medically fragile themselves. And maybe those can be our remote learning teachers. And it may mean readjusting classes and things of that sort. But we won't get that accomplished here tonight. But I think as we hit it early in the morning and spend the rest of our days and weeks, we get that accomplished because we want to do what's best for our kids and under these horrible conditions. We are in a pandemic and we are in a crisis mode. And because there is no playbook for school districts and how they respond to COVID, we're grappling all the time with how to do what's best for our kids and community and how to do that safely. In the midst of COVID, we all have our challenges. And it's important for us to be reminded that we all need to pause and take a deep breath and remember that we all are under a tremendous amount of pressure and stress. And that we all want, and I'm convinced to the bottom of my heart, that we all want what's best for kids in our community. The issue is how do we go about getting that done? And so we're open to pivoting and adjusting and getting input like we did tonight from our stakeholders and doing what's best. And it's going to take all of us giving input and giving various perspectives and going back to those 4 agreements we had when we first opened up a board meeting about respecting viewpoints, listening to people, and assuming good intent. And I think we really have good intent, but it takes this whole village called Albany to really get it right. And I think we will at the end. And so I appreciate the comments. I appreciate the perspectives. But with all that said, we have to go back to the simple question, is this good for kids? And if we can't say that with enthusiasm, we need to revisit and repivot that. And so that portion of remote learning, for example, is something that we have to go back to the drawing board. And it was loud and clear to me, it resonated that this needs to be adjusted because kids should have a live teacher one way or the other. And we have to figure it out, and we will.
Okay. So hearing that, it sounds like there's going to be have to develop have to look at that again, and also have to develop a couple of surveys and get those out, and then come back to the board with that modified plan and with those survey results. So that seems to me like that's the best outcome that can happen from what's been presented tonight. So,
Board President Tutain, it's crystal clear on the board's direction, and we appreciate that. And we would move forward with the greatest enthusiasm. And I'm looking forward to come up with some amendments that the board and community can get on board based on their input. So thank you so very much.
I'd like to add something real quick, President Trutain.
Sure.
Yeah, I'm going to try to say this as respectfully as I can. A survey is definitely going to push back the timeline. We have been out of school in this distance learning mode for 7 months now. So we can't go back and redo things, but to find out now that apparently everything is on hold because we have to do another survey is disappointing from my standpoint.
Let me clarify. We're not putting anything on hold, and we've done surveys in the past, so we have some information. I think what I heard is that folks wanted an updated survey, but we're not pausing. We're moving full steam ahead with our bargaining units and working to resolve this. But we're not putting anything on hold. So I wanted to clarify that piece.
Well, yeah, we have had 7 months to address a lot of these concerns.
Well, I hear you, and you're right. It has been 7 months, but I also think the circumstances of the pandemic are changing. So what somebody said that they wanted in a survey that was done last June, could well have changed since then. I think that we were looking at about 25% of our parents said that they didn't want to have their kids come back to school, but for this school year. But I wasn't even going to mention that number because I want to hear what they have to say now, because we're much further along in the pandemic. We know more about the disease. We're reading about it every day, hearing about it on the news. And so we just need to do a check-in with our staff on how they're feeling with the current situation, and our parents, because things, circumstances within their family may also have changed because of the pandemic. Maybe they have an elderly relative living with them now that wasn't there in the spring. So we just need to do a little reality check in what we really need to plan for. And I appreciate Dr. Wells saying that he's keeping all of our negotiations moving forward and keeping our facilities readiness rolling on so that we can reopen. I would like to suggest that we table the second item, item number 6, the at-a-glance governance calendar. I don't really think that we need to deal with that tonight.
I second that.
Okay. And so I will ask for a vote on tabling item number 6-1.
Certainly. Student Board Member Corzo Clark?
Yes.
Student Board Member Mala?
Yes.
Vice President Duran?
Yes.
President Trutain?
Yes.
Trustee Hinckley?
Yes.
Trustee Doss?
Yes.
Trustee Clark?
Yes.
Okay, thank you, board. So the tabling item 6-1 passes unanimously. I know that not every community member got a chance to speak here tonight, but I think that the messages came through very clearly. And I also wanted to bring forward that the superintendent is holding a forum on Thursday night to allow everyone more time to have their voice heard about reopening plans. So I really recommend that you join that forum. And this item the reopening plan, the hubs, the target dates, all of that will definitely come back to the board. The district needs to work on this a bit more.
Is that open for discussion, whether to take the rest of the public comment? Because my preference would be to do that.
I also second that suggestion and have an additional question before we move to more public comment.
I have one more thing to add. It's related to that.
Okay, I think that, so I heard Trustee Hinckley said that she would like to hear the remaining speakers. I heard Trustee Doss say that he agreed with that, but he has a question. And then Trustee Clark said that he had something else to add. So I think we start then, Clementina, excuse me, Vice President Duran. And so there's, everybody wants to have more comment. Let's begin with the board comments. So Trustee Doss, go ahead.
My question is, I had mentioned before the board discussing a target date and giving instruction for a date to when we would like to see hubs happen. And I know the superintendent gave his reasons as to why those hubs couldn't happen. And so, I had a couple of comments surrounding that. And in the interest of working together, if the board makes a decision, and I'm not saying that we would or wouldn't make the decision, but I'd like to have the discussion around making the decision and having some exact dates. If we did indeed make that decision, and then there's another group involved and that group says no, that doesn't feel to me as if we're working together. That feels to me as if the power has shifted, or the governing power has shifted from the board to the other group. But we can discuss that more as a board. And I'd like to see if we could finalize some dates so that, one, the community has an idea of when this could happen, but also so that both parties involved, have instruction from the board so that they could work accordingly towards that date. President Yu-Chang, I think you're muted.
Thank you. So I just want to, okay, so I don't know if Dr. Wells, do you have anything further to add about the setting a date for the hubs? Because Trustee Doss, I think, wants to know like process for that.
I don't have anything specific to say to that, other than that we are committed to working together with our bargaining units. And so I heard Trustee Doss and I heard the rest of the board, but I have nothing to add at this time.
And so I want to clarify that as well. The hubs, I want to provide an option for parents who need in person. If these hubs are supervised by other staff members or by paraeducators or by, I'm not, I don't want to get into that part, but having some type of supervision for kids who need an in-person option, even if it's an in-person option for them to facilitate their distance learning. There are parents and students that are struggling and they need an in-person option. The hubs were in place for the most vulnerable and the most in need. And so that's why they gave the exception for them. And that's why the exception has been in place for so long, because they understand that it's an emergency, it's a 911 thing, that there are students and families, in need of that. So, but also would this apply to ACC and staff who have emailed on multiple occasions saying that they are ready and willing? And so does this apply to them, and how, and working on the preschool option for those students? So I just want to talk more about that, but have more concrete dates in mind so that we can really work towards getting things done and not kind of pushing it more and more down the road and more down the road. Then it'll be 2-3 months later and we haven't actually done anything, and these parents and these students are still suffering while we're scheduling more meetings and doing more surveys and scheduling another meeting on top of that. So I think we need to put something in place so we can really move this forward. If we just say when it's safe, the world is, I mean, I don't know, like if we can, because we've got recommendations from the state and from the county, they gave us a date. So if we're going to use, we should use that date if we're saying that we're relying on the experts. So I think we just need to clarify that. But if there's not a second from a board member on that, then maybe we can't do it. But
I think it goes now to Trustee Clark.
Yeah, thank you, President Chutain. I always like to speak from just my own perspective as one board member. I don't see this meeting coming to a conclusion by 10 o'clock tonight. So if that's the case, I'm proposing that we have another special board meeting. I believe we need 24 hours notice. So that could be on Thursday night. And if the rest of the board would like to weigh in, I would also like to have this be moved to review and action. So at least the board has the option to weigh in. I mean, I just don't think we can this is my point. I think we're kind of just stuck and we're just pushing things back and things are going to go farther and farther and farther back. I'm really concerned about the way that this came up, that it wasn't even an option for us to vote. And I'm really concerned for the 6th through the 12th graders. The letter that I saw from the county superintendent said that their timeline would be 4 to 12 weeks. If we're saying March 13th or March 15th or whatever, that's 5 months, not 1 to 3 months. And I'm concerned that if we don't meet that March 15th, then we're in April and May. And then all of a sudden, those secondary students have been out for over a year. And especially our seniors. I mean, I know that there's a pandemic going on and there's some serious stuff going on right now, but I'm really concerned about our students' well-being. And I know that there's no easy decisions here, but I don't think we're going to come to a conclusion tonight at 10. So that would be my suggestion, to have another special board meeting on Thursday. And that's just my perspective.
I think the student board member Mala indicated that she wanted to speak.
Yeah, I was just going to say, while we were on the topic of surveying, that Leo and I had data to present from the 2nd or 3rd of October. So whenever that's appropriate.
I'd say it's a good time now. Go ahead.
Okay. Ms. Jen, could you screen share the slides? Thank you. So I think it's the October student reopening data. While she's getting that up, I can introduce it. We put a survey forward in July, which we shared with the board. So this data is just comparing the same questions that we asked in July to the student sentiment now. So it'll give a rough idea of how students are feeling compared to how they were feeling in July. And this was conducted over Instagram to increase the range of students that were able to access it. And we didn't add any questions because there is an AHS survey going out today. I think that went out. So that will give more specific insight that the board can later access. So Leah will take you through this.
Yeah, this was the first of 3 questions we asked, and it was very basic. Despite personal desires, do you feel safe returning to school on campus? And overall, the data was kind of similar, but if you will look at the numerical values as well as the percentages, we had an increase in turnout for this survey, and an increase an increase in people who were not comfortable or did not feel safe returning to school. If we go to the next slide. Sort of so in this next one, do you believe that your peers will follow safety guidelines? You know, this includes social distancing, frequent washing hands, wearing masks 100% of the time while on campus. And once again, there was a similar trend in the data as the last question, where there was an increase in turnout and then an increase in skepticism, or an increase in the belief that their peers would not follow safety guidelines, which likely contributed to them not feeling safe going back to school. And then the third question. The third question was, regardless of safety precautions, do you feel you would be at risk of contracting COVID-19 if you were returned to campus? The majority of students said yes. Again, an increase in turnout and an increase of students feeling worried about returning to school on campus. And so all of this, Audrey and I discussed, and again, this was an Instagram survey, and we put it on social media to increase the turnout that we would get, because not every student checks their emails frequently as they do social media. So it's not scientific, but we do believe that this is this can be interpreted as a good representation of the attitudes of the student body, or at least a significant portion. And what this tells both Audrey and I is that a lot of students are very skeptical of returning to campus, despite whether they want to or not. And I think that going off of the sentiment of previous speakers from the public as well as from the board, in terms of the contrast between the remote and the hybrid in-person learning, is that there's going to be a lot of students, including those with immunocompromised, special needs, disabled students, who cannot physically return to school, or those with immunocompromised family members. There are also a lot of students who are able-bodied but just don't feel comfortable. And I know anecdotally from friends I've talked to who have returned to school and are now on campuses where there are students with COVID, that stress really undermines their education and how much they're able to focus in the classroom and focus on the work outside of the classroom. And so I think that, circling back to what a lot of people have said, that the 100% remote learning, we should anticipate that a lot of families are going to want to opt into it. A lot of students are going to want to opt into it. And therefore we should try and make it as equitable as possible for those students, regardless of their medical needs for doing so. Thank you. That's all we had.
I want to give a really deep thanks to our student board members for having conducted this survey. This is fascinating data. I'm so glad that you brought this to the board meeting and shared this with us. I believe that Vice President Durand indicated previously that she wanted to speak. Wait, I think you must be muted.
Sorry about that. I want to follow up on what Trustee Clark said, because I was a little surprised. I actually thought this was about discussing and having action tonight. And so I ran back just to check out what the agenda actually says. And it basically just says staff report. And then number 6 is review and discussion. But since, we had wanted this report back in May and the superintendent had said October 6th would be the date for a report, I actually thought we were making a decision tonight. And since we are not, I would definitely second Trustee Clark's motion, if he wants to make one, that we come back in 48 hours is the legal notification we need, because I certainly respect what the students have reported out in terms of the secondary or the high school students at least. And I think most of the feedback that we have gotten from parents as board members has been from elementary. I don't recall one email from noting a parent saying they were they had a high school student. And so the input has really been primarily, if not only from elementary parents. And based on that level of concern that was expressed, I think we have got to do our due diligence and get back to parents and say, yes, we are going to take the responsibility of making decisions. Now, it may not be a decision that I like, but it's a decision that the board as a whole needs to make. And I don't want us to keep putting this off. And I actually thought, like I said tonight, that we were going to make a decision. So I would just say that if Trustee Clark doesn't make a motion to meet in 48 hours, then I will. Thank you.
Yeah, thank you, Vice President Duran. As far as some clarification, I believe it's 24 hours that we have to give notice. So we could, if the board agrees, we could come back on Thursday night as long as we posted it tomorrow at a time that gives 24 hours before the actual meeting happens. Is that correct, Dr. Wells, as far as the...
That's correct, Trustee Clark.
So yes, I would like to make a motion that we can come back on Thursday evening. I guess time to be determined. And it doesn't mean we have to vote. I just don't like having my, or the board or me in particular, our options are just not here right now. And as far as, yeah, so that's my, let me rephrase that. My motion would be that we come back on Thursday evening and have this on review and action to continue this conversation. You know, it's not like it's going to be a lot of work for staff. You don't have to put together another presentation. We just come right back and finish up on the conversation where we end tonight.
Before I second, can I just ask one question of the superintendent, which is, you were having a forum with parents again, is that correct? And was it for Thursday?
Yes, and as you know, life happens. So if I need to postpone it, that's fine too. I would go with the will of the board.
What time is your forum?
Good question.
We're scheduling for 6 p.m. But if I can postpone the forum if the will of the board is to have an emergency meeting or a special meeting on Thursday. But you know, we can also have the special meeting Thursday, maybe at 3 to 5.
Or what about after? What if you had the forum from 6 to 7 and then we had our meeting at 7 o'clock? And that way we could also you would be able to provide us with feedback, or we can certainly jump on the Zoom and listen to parents at that time.
I'm open to whatever the will of the board is. So I'm flexible. I'm here to serve.
I like the...
Okay, if I could just, as sort of a procedure, just second Trustee Clark's motion.
And, you know, okay, so we'll have a vote on that because there's been a motion and a second. But I also want to just ask the board, it's not clear to me exactly what you would want to vote on. I mean, to me, it seems like, and I'm just one board member, but directions to staff are very powerful. And, you know, we've already made two directions to staff. So they're going to rework the remote learning plan, and they're going to check in with our parents and our teaching staff about, you know, about their wishes for remote versus in-person learning. And so to me, I don't feel like any of our options are taken off the table by having this report simply as a staff report. So in terms of, yeah, so I guess that I would just ask all of the trustees to to consider what exactly you might be wanting to vote on.
I know myself specifically, I would like to vote on, well, one, I've said it already, and I feel like it's, is to have an actual, target date for in-person, whether it be, hub or facilitated distance learning or just supervision of the students in need. But then also I'd like to vote specifically on if we're gonna open the preschool, because we had talked about that before, and that's outside of the jurisdiction of the other parties that we were speaking about. And the members of that specific entity have spoken at board meetings and emailed on more than one occasion and discussed, the eagerness to want to, open back up. So, I would think that we would discuss and vote on that at the next meeting, as well as target dates for when we actually will see things open. And I apologize, Trustee Hinckley, I saw your hand, so I apologize for kind of cutting the line there.
No problem. We're fairly informal here. So my understanding is that the preschool was listed on the target date slide that Dr. Wells presented as opening on November 5th. So I thought that was the target date for reopening the preschool.
Yes, that was, and I want to give clarification. We did survey our preschool teachers, and 2 of the 4 are willing to return.
Okay, and also just a point of clarification, the guidelines regarding hubs, that would apply only to our students with special needs and to our ELL students, or am I misinformed?
I think you are informed. Hubs can apply to a number of folks, but the ones that were targeted in the language from the state, it's those who need an intervention, second language learners, ALD, special ed, and we added mental health because we know that's important, and we're exploring some connectedness around mental health, trying to do some in-person outdoor activities sooner than later.
Okay, so you're really considering 4 categories in terms of hubs. So students that need it for mental health reasons, students that need intervention, English language learners, and special students with special education.
That is correct.
Okay, thank you. Okay, so the motion on the floor is to basically have a continuation of this meeting, but instead have the staff report designated as a review and action item.
President Kutane, excuse me, but Trustee Hinckley was supposed to have been able to speak.
Oh, I'm sorry, I forgot. Yeah, okay, so go ahead, Trustee Hinckley, then we'll have the vote.
Yeah, so I feel like we can give staff direction in this meeting that to me is just as meaningful as taking a vote. If we were to, for example, give staff direction to accelerate one piece or slow down another piece or take specific actions in order to improve this plan when it's brought back to us. My concern about having a meeting on Thursday is that we wouldn't have much more information. We wouldn't have given parents time to respond to any revision in a plan. It doesn't seem to me like it gets us any further. And I don't see any barrier to giving very strong direction to staff in this meeting that would then require them to move forward on things and bring them back to us next week, perhaps, when we would actually have time to gather meaningful parent feedback, when they would have held another negotiation session with our staff I'm just concerned that we're going to spend another 2 hours spinning our wheels, and a vote is no more meaningful or enforceable in this context than giving direction to staff. I mean, we could vote to open the high school, you know, in 2 months. It's meaningless without giving them the direction to make the plan closer to what the board would like to see. So, you know, we can have a vote about it, but I just wanted to express my strong reservations about just coming back in 48 hours with virtually no additional information, no opportunity for meaningful community input in the meantime. We've already stated that we want a significant part of the plan to be completely rewritten. So I don't know what we would be voting on exactly. And I would rather have staff spend the time constructing a meaningful survey to get information from our families, which I agree would have been nice to have done, you know, a few weeks ago, and to sit down with our staff, which isn't going to happen between now and Thursday, and to have us spend some time tonight after we hear from the rest of the public, seeing if we can come to consensus on some direction on the other elements that people have brought up around timing and specifically around the hubs. I don't see any reason we couldn't give direction on the hubs, for example, that is just as strong as us waiting 48 hours to come back and take a formal vote about the hubs. That to me just slows it down for 2 days. And we could do it now if that, for example, was the will of the board. So I just want to state that before we actually move to a vote, that I think it will actually just slow us down and not sort of keep us moving in making the plan into a better plan.
Can I respond, President Trutang?
Sure, go ahead.
Yeah, so just as one board member, I don't think direction to the staff is nearly as close to as strong as a vote from the board. And as far as what will we be voting on, I've heard quite a few times that the board kind of role is the what and the district is the how. So we'll be voting on what we want to look like as far as remote learning or some kind of hybrid model, and then that would be up to the staff to do the how and to implement it. So I think you had brought up earlier, what exactly we'd be voting on? Do we want to move forward with an option to give our families the choice what they want to do, and then it's the district's role to figure out the how part, not ours.
If I could say a word that I agree with what Trustee Clark said, and the discussion to me, the decisions that we have to make are about turning the lights back on, right? That's what this is about. And that's why we did have parents respond to us. And this is a result of not only, you know, that now we can make a decision because Alameda County Public Health Department gave us the go-ahead, the green light, and because we've been talking about this or planning this tonight's meeting since July 15th or whatever that date was. So to me, it's like I'm ready to vote on when we're turning the lights back on for our TK through elementary, through even 6th grade. And I would say, I would certainly include early childhood as well, ACC as well. So I'm ready to do that tonight because I think we have heard from parents, and I'm not saying we've heard from all the parents in the district, but I think we certainly have a notion about how parents are feeling at this time in general, and both sides, right? Some feel we should not come back, and others feel, yes, it's time. And so I think that we are, as a board, postponing our responsibility, especially if we just give direction, as opposed to a clear vote at this time. And so that's why, to me, if we needed the 48 hours or 24, whatever, to call for a second meeting, that's why I would stick to the motion as it is.
Ms. Sind, could you go ahead and call the vote, please?
Sure. Student Board Member Corzo Clark,
No.
Student Board Member Malo,
No.
President Trutain,
No.
Trustee Hinckley,
No.
Trustee Doss,
Yes.
Trustee Clark,
Yes.
Vice President Duran.
Yes.
The motion passes to have an emergency meeting on Thursday evening with 3 in favor, trustees Clark, Doss, and Vice President Duran, with Board President Trutain and Trustee Hinckley opposing, as well as student board members Mala and Corzo Clark.
President Tuchain, can we have point of clarification of what the motion was so that we have clarity on what we're supposed to be doing?
Yes. So Trustee Clark, you can go ahead and restate the motion.
Yeah, that we bring back this discussion on Thursday night with the item being under review and action. I don't know how much clearer it needs to be.
Well, someone's going to have to develop what the action item is that we would be voting on.
It would be the presentation, and we could make amendments to it and vote it up or vote it down.
And thank you for the clarification.
Okay, so there was also
Question for clarification. Because both of the student board members voted no to the next meeting, they do have the option whether if they attend or not attend. I mean, it's totally up to them, and but they do have the option whether they want to attend or not. I mean, it is an additional school night in which they would have to, stay up and attend the meeting. So I just wanted to get clarification on whether or not they can, opt out of that meeting.
I think that we always give our student board members the option of not attending, that school comes first. I think that our student board members will have to make that decision on their own. Of course, they're welcome to be a part of the discussion also. So I just leave it to them and their own discretion about the where they need to be.
Okay. One last thing, President Trutain.
Sure.
Yeah, I wish I would have been a little bit clearer as far as the time. I think Trustee Duran had mentioned the parent meeting that Dr. Wells has. So I would prefer, I don't know if we have to do it again, but to have it after. So Dr. Wells can still speak to those parents. I think VP Duran might have said from 6 to 7, and we start at 7 or 7:30, but I would like to have it after so Dr. Wells can still hold that meeting.
Well, I mean, a superintendent forum, I mean, is up to him. I mean, I would assume that he wouldn't have the forum at all, given that they have to prepare for this meeting, and of course, if we have another meeting, then parents can comment during public comment as a part of this new emergency meeting. So of course, that's up to his discretion. I would assume that the parent forum would be canceled.
I agree. It should be up to him, but that was just a suggestion.
Yeah. Okay, so we have gone past 9. I'm sorry I didn't ask for another extension, but we will need to vote on our second extension if we want to go ahead and hear the rest of the community's comments.
I'll move that we extend the meeting to 10 o'clock.
I second.
Okay, may we have a roll call, please?
Student Board Member Corzo Clark.
Yes.
Student Board Member Mala.
Yes.
Trustee Hinckley.
Yes.
Trustee Doss.
Yes.
Trustee Clark.
Yes.
Vice President Duran.
Yes.
President Trutain.
Yes. So our second extension passes unanimously. And we will move back then to public comment. I believe our next speaker will be Addie Wilson.
Hi, this is actually Maria Wilson. Addie is my daughter. I guess this is logged in from Zoom school. But hey, I just wanted to thank everyone for being here tonight. I'm a parent of a first grader, Marin. And what I'm wondering actually is, as I'm hearing public comment tonight, is why a full-time option is actually not on the table. I'm hearing that, back in the beginning of the pandemic, but 25% of the parents didn't want their kids in school. Now it could be more and could be less. And so looking at the Alameda County guidelines and the California Department of Public Health guidelines, it seems like for the elementary levels, it's possible to get to a stable group of 18 or a stable group of 16. And a stable group of 16 is really what's recommended in terms of the maximum for putting together a class. So, I'd be very happy if Marin opens and Marin opens for hybrid. But as we're evaluating, the amount of capacity, both from the teachers who are willing to return to school and the parents who are willing to send their children to school, and the parents who are not or cannot, and the amount of strain, stress, and potentially waste a hybrid option could present if you result in small hybrid cohorts. I'd appreciate the district exploring whether or not it's possible to get to a stable cohort of 16 at the elementary level as part of this new study. Also, really appreciate Trustee Doss's input tonight and recognition that that there's an enormous amount of privilege here, being able to participate tonight and really being able to support any level of remote or hybrid learning that is going on. My daughter's teacher is fantastic, and my experience at Marin has been fantastic. But really, there is no way for any child really to be and remain at grade level without significant parental involvement in this remote paradigm. And so really appreciate the recognition that parents and the community and our employers have to play in supporting our kids. Thank you.
Thank you. We will now move to Samuel Juria.
Yeah, I just want to say I can't really believe these dates are out as far as they are for these target openings. I think the original plan was the district and the board would revisit tonight. And back in July, Dr. Wells said if you voted tonight that the schools could open in a month, in November. So why is it 2 more months out now? The guidelines haven't changed that much. All that's really been added is Alameda says kids up to 3rd grade or whatever need to wear masks, whereas before it was just a recommendation. So I don't really get why these other districts like Palo Alto and the districts of Marin are voting to reopen and have approved reopening plans for the next couple of weeks, but your target dates are out 3 months away. I mean, I don't get what's going to change between now and then. If you look at what Palo Alto went through, the superintendent offered every possible security, measure possible, and the teacher, and what more can I offer you? And teacher said nothing. So at some point, if these other districts open up like they're planning to, and the teachers come back, and things go smoothly, you have to move up your opening dates or get a better negotiator. I don't know what to say. I mean, what's different about Albany? The other thing I want to say is I don't know why you would send out another survey. You send another survey, 90% of teachers are going to say they don't feel safe coming back, and 60 to 80% of parents are going to say they want to send their kids back. I mean, we're not living on another planet. So that's all I really had to say. Thank you.
Thank you. We move to Payal Sampat.
Hello, hi, can you hear me?
Yes.
Oh, okay, great. Well, thank you, everyone. Appreciate your extending the meeting and appreciate all the work that's gone into these options. I just wanted to provide the perspective that I think we're we're in the middle of a crisis. These aren't normal times. These aren't sort of times where you say, you know, why didn't we figure this out 6 months ago? Our information is changing day to day, week to week. We know a lot more about this virus now than we did previously, and we know a lot more about how remote instruction is working. I think teachers have done a really remarkable job with remote instruction so far. It's nobody's first choice, including the teachers, but I really think that at this point, the kids and teachers have finally hit their stride. And this is a stable environment. And the idea of kind of rocking the boat at this moment, even if it's January, and having the rug pulled out from under our feet is really alarming to me as a parent, because, you know, breaking up the cohorts, having some go back to school, some remote, getting a different kind of instruction, it sort of is defeating the purpose of keeping these cohorts together and ready to go back into the classroom when it is safe. And I'm not saying, you know, 100% safe, but when as a community, we're in a better place collectively. And I also wanted to emphasize that I think that the mental health issues go, you know, both ways. I mean, there's also, there's physical health issues, right? There's concerns from kids about bringing virus back to their families, concern from families about choosing between their kids actually getting in-person education and having to be exposed to the virus, having to expose grandparents and immunocompromised family members.
Thank you for your comments. We move to Sarah Haller.
Good evening. Can you hear me?
Yes.
Great. I'm a teacher in the district. I'm also a parent of a Marin third grader who's really, I just want to echo the statements about how wonderful the Marin third grade team has developed a program that is really robust. And as much as it could never replace an in-school experience, I'm really feeling like echoing the last speaker, we have hit our stride. So thinking about, you know, the changes ahead is obviously a scary thing, both as a teacher and as a parent, but of course we need to be moving in the direction of getting our students back. So I'm so glad to be a part of this community and a part of this meeting tonight. I'm specifically wanting to speak to the one question and answer Q&A slide that Dr. Wells presented, which asked whether staff would have the option to opt out or choose remote in the same way that we're granting that option to our families, our community, Albany community families. And the answer was that teachers are eligible, or staff is eligible, to take the Coronavirus Family First Response Act. And I don't know if Ms. Gonzalez is still on the line, but it's my understanding that that leave is only available to those who are seeking medical diagnosis for COVID, experiencing symptoms, caring for loved ones or family members who are dealing with the virus, or those who are caring for children or dependents who are not able to be in care due to coronavirus issues. So that doesn't really leave any recourse for teachers who have health conditions or other concerns that maybe are similar to those that our Albany families are facing. And so I'm curious if the district is intending to explore some of the ideas that were brought up in the latter half of the meeting, such as the one that Dr. Wells mentioned, that perhaps we could consider creating a pod of remote-only teachers and others who are willing to go back in person. So I hope that the district will continue to work with ATA and other labor partners to come up with creative solutions in this difficult time. Thank you.
Thank you. We'll move to Ms. Lucy.
Hi, sorry, this is not Miss Lucci. My name is Daniel Westcott. I'm the father of a second grader at Cornell. Can you guys hear me, right?
Yes.
Okay,
Go
good.
ahead.
So I just want to say, first off, thanks very much for everybody is coming together with the best of intentions, and everybody has the interests of students and parents at heart. And that needs to be reiterated over time, because there are tensions in what the goals are here. And we need to make sure that we are all coming together in good faith. And I have no doubt that you are. That being said, so the road to reopening is testing, and that nobody is really addressing that at all. If you're doing surveillance testing and monitoring of a population, you can catch outbreaks early and you can close them fast. So without that in place, I don't see how you guys are even talking about coming back to school. There's like, and I want to go back to school. Like, this is not a good situation for anybody. But at the same time, it's not safe. It's like the fire is burning the school down. We evacuated the kids, and now, you know, nobody put the fire out. And we're saying, well, how do we get the kids back into the building? Well, the way to get the kids back into the building is to do monitoring of whether or not there's a prevalence of COVID-19 in the population. And if you're not doing that, and if there's not a strategy to do that, I don't see how we move forward. And maybe it's cost prohibitive at the moment, but we have to kind of figure out how to get to a surveillance system that actually makes it possible for us to all come back safely and feel comfortable with it. And until we do that, or until there's a vaccine, I think we need to be at home. And I wish that we didn't. And the hybrid model basically is going to increase spread. But there isn't a good solution at the moment unless you're monitoring your population. So I really appreciate your time and your goodwill here, but I don't think we can go back yet. Thank you.
Thank you. And thank you to all of the speakers who have waited patiently for their turn. I do appreciate you keeping with us. We'll move to Hans Sachari.
Have a, uh-oh, I've been muted.
We could hear you a second ago. Maybe you can.
Okay.
Go ahead, we can hear you.
Okay, sorry, I have a TK and a fourth grader, and this is not school. I just want to say, like, I've been listening here and there when I can, and I just want enough voices to be heard that this is not school. I have a fourth grader. Unfortunately, her name is on the screen because I had to sign in her to make this meeting, and she is not challenged. Tomorrow is Wednesday, and she will have a total of 50 minutes of work. There's a lot of technical issues. Her Zoom one-on-ones oftentimes get canceled because there's so many technical issues. Her Zoom is glitchy and she misses out on her one-on-one instruction. Why are we, pretending that this is school? Or why, why are we, I understand that some families cannot return to school, just like some families have immunocompromised members and, sometimes have to miss school because of asthma or whatever it is. And I don't think that we should make that the normal. We need to have school. And I also have a TKer who, her teacher's wonderful and is engaging a bunch of 4 and 5-year-olds via Zoom, and that's wonderful. But it's literally 30 minutes a day. And I'm trying to advocate for the families who don't have childcare. I mean, so many of us our work has really suffered. I mean, we have to pay our property taxes. We don't get any break on that, and the school district is funded, and we are not being given an education. This is a stop guard. This is absolutely a stop guard, and I feel so disconnected from the teachers and from the parents who, I think the Albany Teachers Union had a presentation where one of the teachers featured said she was going to take time off or take leave to support her daughter through TK. I don't have that luxury. Neither does my husband. We don't have the job protection to do that. Or, even if we could afford that. And then to hear, the ATA speaker, Mr. Naif, again today saying teachers take leave when they have to, not because they want, not because they want to. It's just, I feel so disconnected from, I feel like the teachers union.
Thank you. Thank you so much. Veronica Davidson, please.
Hi, I'll be really quick. Thank you guys so much for taking the time to do all this. And I know it's getting late and you've all extended it. I just wanted to reiterate that I'm really happy you're putting out another survey. And I wondered if the elementary surveys that went out recently had results that could be shared. I don't know if that's a possibility. I think it would really help for us to see the updated numbers of who is going to opt in which direction. And I also really appreciate that you're taking the time to clarify what the remote learning would look like for families who cannot opt back into hybrid. I would like to revisit as well, if we're going back hybrid, maybe revisiting full-time cohorts. I heard earlier, I think it was someone on the board or Dr. Wells mentioned that this was only a part-time teaching day. Actually, I think it was a speaker. And could the teachers maybe do the remote learning in the afternoons? I also heard that we're going to use our specialists to fill in other gaps, which would mean that the teachers don't get those planning times during their teaching days that they're used to having and are critical to their teaching. So I think there's a lot of intricacies here that we're layering on, and we're maybe not thinking all the way to the next step of how this would play out in reality. I just saw in the Chronicle today that California is not linking huge increases in numbers to schools reopening when it's done safely and carefully. And they're saying also that that's very much in the preliminary stages. But I also think that we're talking about having a cohort of 12 children, a break day, and then another cohort of 12 children. A teacher could still be exposed in that time. And then we could have cross exposure in those two groups. So I would wonder again about one teacher and one solid group and keeping another teacher for our kids. In my own mind, I know I'm running for school board, so this is hard for me even to say. I would love to keep consistency for our children, however we can do that. Thank you.
Thank you. Now we move to Tomas Makaharju.
Hi. So this is actually Simo Mäki-Harju. I'm Tuomas's dad. So I am a parent of 3 elementary school students, and while I hope to return to normal, I'm also a professor at UC Berkeley participating in an effort to investigate the role of droplets in the spread of SARS-CoV-2, and I'm collaborating with a larger national effort to study this. We now know that it's likely that SARS-CoV-2 is also spread by aerosols. We know that filters, including MERV-3, while they make it safer, they are no guarantee of safety. And we know, perhaps critically for this current discussion actually, that reducing the number of people in any space reduces the risk of spread. No person is in a risk-free group. While the risks are lower, children and young adults with no known pre-existing conditions can also get very sick. And we also know adults who are, we personally know adults who are still 6-7 months on. Now, since the illness is not, unfortunately, under control in our community, we do feel uncomfortable returning to school. We are fortunate to have the flexibility to work weird hours. That also does mean working until 2 a.m. many nights, and even with the whole family participating, struggling to keep the kids at grade level. That said, we all want what's best for the whole community, everybody included, and maybe there is a different approach that could be considered. I would strongly urge those who can, no matter how hard it is, to keep their children in remote education to reduce the risk for those families who have no option. That is, provide a good remote education option for anyone who can, even reluctantly, continue remote and make the school safer for those who have no option. That is, urge, encourage, support everybody who can to keep in remote education and make it safer for those families that have no choice and have to get back to in person. Thank you.
Thank you. The Petzold family spoke earlier on the same issue. We have very limited time here. We do have a hard end at 10 o'clock. We've had our 2 extensions. And so I'm going to keep with people who have not yet had a chance to speak. Also, you do have 2 minutes. That's what everybody else has had. But if you are able to make your comment and make your point in less than 2 minutes, I would really appreciate it, because we will run out of time before we run out of speakers as it stands. So Andrea Venezia, please go ahead.
Great, thanks so much. Can you hear me?
Yes.
Thank you. So I am a parent of a student at AMS, one at AHS. I'm a public educator, and I run 2 statewide initiatives on educator leadership programs that center students in equity. So I'm using that frame a bit more right now because I am incredibly privileged. And this is having a huge effect on my children. Make no mistake about it. They don't like learning anymore. Their mental health is at risk right now. So I don't take this lightly, but it's not about them. It's about our community and about our students who are most marginalized and at risk. So that's where I'm focusing my comments. Basically, I'd like to propose that you take the option of opening at scale for all grade levels off the table. And I'm saying that from a leadership perspective, to be able to calm the community down and focus on the students who need it the most. And I really want to reinforce the last speaker, because I think the incentive, and I'm so glad that hybrid idea is off the table that was presented tonight, because it's exactly the wrong incentive. You want parents to want to keep their kids in virtual learning so we can keep people safe right now. You really don't want to incentivize us to send as many students forward as possible. We know that we're heading into cold or flu season. We know we're falling off a fiscal cliff with our schools right now. We know our ventilation's not adequate. We know our spacing's not adequate. My children are in 7 classes with over 30 students in their classes. I cannot fathom a way to make that work right now. We don't have testing, tracing, appropriate PPE. And you have teachers who have done an extraordinary job with amazing online learning. It still stinks for everyone. You're not going to make it great, but please don't engage in wishful thinking about mental health. Sending students back in PPE with distancing and not being able to eat and be with their friends, we are learning that is not great for mental health either. So please take it off the table for wide scale, all grades going back, and focus on the most vulnerable only. Thank you.
Thank you. We move to Chris Karuba-Katz.
Sorry about that. Can you hear me?
Yes.
Hi, thank you. I am a parent of a 2nd grader at Marin and a high schooler. And I first want to thank you all for all of the thoughtful thoughts and comments and discussion, especially the school board members. I need you to hear this. I am a high-ranking government official, and I understand what the school district is going through. You cannot put everybody into the same bucket. The last speaker, you're right on point. Middle school, higher end middle school age kids and high schoolers should not be put in the same bucket as elementary school kids. My 2 youngest are 2 years old and 7 years old. As a result of being an essential worker, we have had to put our children into creative spaces for their mental health and for their ability to just get through this pandemic, while we have very, very, very challenging jobs requiring us to keep the community safe. And there are many families in this community that are in the same boat as mine. We've had to make it work. I want to encourage the school district. You can do this. I've had to do this. I've had to be creative. I've had to put my staff in different buckets. Those that are at risk to get sick and die, maybe if they catch COVID, keep them out of the office. Absolutely, you can do this. Those staff members that want to come back, put them in a bucket. Those that want a hybrid, put them in a bucket. And then please extend that same courtesy to the families. We are your community. Please extend that courtesy to us. I was very disappointed that you frowned against potting and us coming together as a community to support each other to get through this. If the teachers can take leave because they can't teach while they are home with their child, neither can we.
Thank you. We move to Adrian Cabanatuan.
I raised my hand to speak because I heard board member Duran say that she hadn't heard from high school parents. And I have spoken at, I'm the parent of a high school senior, and I've spoken at a number of the meetings that have happened here. So I certainly hope you hear me now. And I certainly hope you've heard from the other high school parents that have spoken tonight. I think that what the high school parents, and I certainly don't want to speak on behalf of everyone, but I think what the high school parents realize is that there is a larger sense of need for students that are at risk and students that have larger needs than, say, a senior or a junior or a freshman or a sophomore as compared to a kindergartner, a first grader and second grader. So I think that it's not that you're not hearing from us, because you are hearing from us, we are speaking. What we are saying, and we've said at a number of events that have happened, whether it's a forum with Dr. Wells, a forum with the principal, whoever is having a forum, we're attending. And what we're asking is that you not do a one size fits all, that there are things that can happen at the high school level for the high school students that can be done safely, and that it's not either all or nothing. And we ask that you think about things that can be done to help the high school students to come back together safely. There is a way to do it. I'm certainly willing to sit on a committee to talk about that, but I would like to see those things become a reality. The students my student is doing quite well with distance learning. Some are having varying success with it, but I know the teachers are doing their best. And the expectation for the high school students is that they're going to be able to adjust much better than an elementary school student. And certainly those of us with high school students, we've been there with those elementary school students. We're quite aware of what you have to deal with. But the thing is that what their needs are at the high school level are different. And I would encourage the district and encourage the board to think that through when thinking about what to do regarding high school students and thinking about clubs and sports and those kinds of things that can come back safely. Thank you.
Thank you. We move to Emily Surowitz.
Hello, hi, thank you. You can hear me, I assume?
Yes, go ahead.
Great, thank you. I just want to touch on a few points. I'm a parent of 4 school-age kids in the district. I have 2 kids at Cornell and 2 kids at Marin. I'm also a full-time teacher at the high school, and I've been teaching there since 2007. I want to speak to a few issues quickly that I heard before. First of all, in terms of leave, I've heard a few people bring up leave and teachers before. My understanding is that it's either a federal or a state, I'm not clear, guarantee to employees, and the Secretary of Labor is mentioned in the frequently asked questions section of the slideshow. So this isn't something that's just this like special treat for teachers that they would take. This is something afforded, I believe, to either federal employees generally or in the state. And in the times that I've taken leave 3 times, it's always been maternity leave. And it's always been a really bad deal for me. I lost a lot of money on it, and I returned to work much faster than I would have wanted to. So I want to be clear that the idea that during a global pandemic, when people are concerned generally about health and safety for all, the idea that teachers would rush into leave in some sort of generous benefit for them is, I think, really an unfair allegation. I also want to say that as somebody who, again, I echo what a lot of people have said. I'm so thankful for the TK teachers my daughters have had, for the 3rd grade and 5th grade teachers my children have had, for my own students that I've had at the high school. Even though they don't want to always turn their cameras on, they're coming around. I love this community. I love this district. I know I speak for a lot of teachers in saying that we want to work together with everybody. And so any allegation that somehow teachers are getting in the way of doing what's best for kids, what's best for the community generally, I stand against firmly.
Thank you. Thank you, Ms. Surowitz. Appreciate it. Let's move to Marta. I think there might be a technical problem with Marta. We'll come back to you. The Huffaker family, please go ahead.
Hi, thank you so much. I just wanted to comment, some of the speakers seem to sort of have an unrealistic timeline about how long it will take to achieve what we perceive as safety and perfect safety. I think that we need to be very realistic. A vaccine widely available for children is very far away. And I do not think that we can wait to open schools until every single person feels 100% safe because everyone is vaccinated. We don't even know if everyone will get vaccinated. We don't know if the vaccine will provide 100% immunity. And so I'm concerned that we are just talking about safety as this thing that's achievable in the next few months, this perfect thing. And I do not think that's the case. However, we do have a lot of science, and there's more and more available science to look at the places where children are fully in school in this country as well as in other countries, and they are not experiencing widespread outbreaks. We need to look at what are those schools doing correctly, where staff and students are wearing masks, for example, face shields. I think that the idea that we can all stay out until there's a widespread safety, that until every single parent feels 100% safe to return to full-time school. As Trustee Doss so eloquently said, this is an extremely privileged position to advocate that we all stay remote, that everyone stays remote, or that we all have a perfect, amazing remote option available until there is 100% safety. I just want to be realistic about what a very, very far away goal that is potentially. Thank you.
Thank you. We move to Angela Thomas. Please go ahead.
Hi, my name is Angela and I'm the SEIU rep. I have been to several of the meetings and I haven't spoken until now. And what I want to do, I really want to encourage you all. But one question I do have before I encourage you is I'd like to know in the survey, how many people will leave if students come back to school? Because there is a cohort that will retire once students come back to school because of exposure. Now I will get to the encouraging. You guys are just where a lot of people are. The babies are consistent. I rep in affluent districts, not just you. You guys are affluent. I got some more affluent than you, okay? And the hybrid with the distance learning is everywhere, because you have the people that want to come back to school. You have the people that are not going to come back to school. You have the young folks that have said verbatim, my grandfather survived the war. I am not going to bring COVID home to him and kill him. People have very, very strong emotions. And when we start talking about bargaining, we haven't got to it here, but in my other areas, I've spent the last 2 weeks bargaining behind the smoke, making sure that we are Cal OSHA approved. We are supposed to have KN95 and 95 masks for smoke for everybody. People are not supposed to go out after 151 on the AQI. I did you guys tonight. You're at 88. Where are the smoke protocols? The school right now is filthy just because of smoke. The MERV 13s don't even do smoke. Now I said that to say this whole pandemic is alive. These things are changing from week to week. Everybody is in the same position. Everybody is struggling with their kids. The mental health is off the chain. I'm so glad you guys are sensitive to that, and I'm not trying to run over my time, but in my other areas, affluent parents are losing their jobs. They're losing their companies. They're losing. People are losing. This is not easy on anybody. And I just don't want anybody to assume evil on any level. That's what I want to say.
Thank you so much, Ms. Thomas. We're moving to Kaz Kim.
Thank you. Okay. I strongly believe that we need another survey for both the families and the teachers. Unless I missed one more recently, the survey result mentioned by board member Trutain, about 25% of the families wanting an online option seems to be the one from June, which is old, irrelevant data. The pandemic condition has changed since that survey, and it is constantly changing. There must be teachers who prefer to remain virtual, while others want hybrid for the entire district. The school board members are so impressed that the student board members are so impressive. If they can get a survey in October, surely the school district can do a survey. As for my family, we're doing okay given the circumstances. Things are going much better than back in spring. Teachers are more prepared. Students are Zooming better. So many, many thanks to the teachers, staff, and board members. As for reopening, I hope the schools will not reopen without at least some adequate upgrades of the HVAC system. We know airflow matters. And this will also be beneficial in the future as the number of fires increase in our environment. And oh, by the way, 2 of my teacher friends retired this year because they were told to return to school. So I fully expect that to happen, as the previous speaker had noted. So thank you.
Thank you. Again, I think that the Petzold family has already spoken to this item. So I'll move to W. Zachary.
Hi. Hi, my name is Ben Wallace, and I'm a member of the Disability Squad. And I wanted to just say a few words about the experience that our family is having. I have a child who is 7 years old. I'm sorry, who is in 7th grade at AMS, who has a disability. I also have a child who is in 3rd grade at Cornell. The 3rd grader, she does not have an IEP. It is tough to see. I mean, she has gone from a child who loves school to a child who says almost every day that she hates school. Just this morning, yeah. And that's hard to see, and we're trying to support her. And I do hope that we can find a safe way for kids to come back for that reason on a broad scale. However, my child who is in 7th grade, he has Down syndrome. He has an IEP, and he's, you know, from a mental health standpoint, I'd say he's doing pretty well, but he's not learning anything. In remote learning. I mean, he's got some wonderful teachers, especially the classes where he's in general ed classes. But in order for him to access that curriculum, it requires my wife or I to sit next to him 100% of the time. You know, God bless the paras, but how can you really provide the kind of support that a paraprofessional would normally provide when you're a screen away? And it's not effective for him. So I really hope that we can find a way for kids with who have high needs to get the support they need. And I'm concerned that there's been no discussion of that in what the district presented tonight. Thank you.
Thank you. Our last speaker will be Jeff Castle.
Hi, thanks. Can you hear me?
Yes.
So I'm a teacher at the high school. This is my 19th year, and I'm also our site tech lead, and I've been in that role for about 15 years, in which I've helped make decisions about technology at our site and district-wide on various committees. I've listened to the whole meeting tonight, and I've heard a desire from quite a few people to return to some model where teachers are teaching some students on campus and other students at home who are receiving synchronous instruction. So in other words, the teachers would have to be doing 2 things at once. And I haven't heard anyone talk about the technology challenges of doing that. And so I just wanted to mention that real quickly. At the very beginning of the meeting, Dr. Wells referred to Assistant Superintendent Williams as a Chief Technology Officer. And I'm not aware of whether or not there was a title change. But I do want to make sure that the community is aware that the district actually eliminated a director level technology position 2 years ago. And then in last spring, one of our tech support employees left, and that position wasn't filled again. So we actually have 50% of the tech support that we did just 2 years ago. And so I really think that if you would have to suspend disbelief to think that we have the resources available at the moment to pull something like that off. Right now, one of the 2 employees is also our network administrator, and they're tasked with a bunch of upper level stuff, managing the network, purchasing equipment for the new Ocean View site, and so forth. And so that means there's 1 person to serve 6 sites. And to implement all this new stuff, it seems impossible. So anyway, thank you.
Thank you. Board, and staff and all of our community members, we're going to continue this discussion about about reopening the schools in a hybrid or other mode at an emergency meeting on Thursday. So with that, this meeting is adjourned. Thank you.